All right, good morning, everyone, and welcome to the Board Insurance Committee meeting. At this time, I turn it over to the superintendent to call roll.
Mr. Lejeune?
Here.
Ms. Mason?
Here.
Mr. Hidalgo?
I'm here.
Mr. Hidalgo, we have a quorum.
Fantastic, thank you. Welcome, everyone. We'll jump right into item 2.1, review and approval of Lafayette Parish School Board Insurance Committee meeting minutes from the June 12, 2024 meeting. Members, have you had a time to review those minutes?
I'd like to make a motion to approve the minutes from the Board Insurance Committee meeting on June 12th, 2024.
I'll second it.
All right, we have a motion and a second. Is there any comment, public comment on this motion? Seeing none, go to vote.
3 for, none against.
Motion carries. Item point 2, discussion and our action regarding group health insurance consulting services and related benefits quote presentations. At this time, what we'll do is we'll ask each company in a specific order to come forward for their presentations. I believe that everyone who has a presentation has submitted it. It's already been loaded. Everything is set up at the front table here. I think Mrs. Gardner and or the other members of the superintendent's team has briefed everyone. So what I'll ask you to do is please speak into the microphones, make sure the microphones are on. We're not only the folks here are listening to you, but we're streaming online, and we need to make sure everyone at home can hear everything that you're saying. We'll ask you to speak clearly into the microphone, and we'll ask you to respect the time that you've been given of 15 minutes. And then after that, we'll open it up for board members to ask questions, of course, or the superintendent, to ask any questions that they may like. At this time, I'd like to ask Lockton to come forward, and they will have 15 minutes to present.
Mr. Hidalgo, can I ask a question? Sure. How is the sequence determined?
I'm going to go down the list.
Okay.
Unless you have a...
No, I was just curious. What was the method?
Yeah, none. Throw a marker at them.
Okay. All right. Thank you.
Thank you.
So obviously, do I need to do that every time or no?
Just this one time.
Okay.
I wanted to stay connected. Whenever I switch to it, it should show your stuff. There we go. And see, you can pause it right here if you need.
Okay. So y'all just either increase it or decrease it, however you need to do it? Okay.
Before you guys get started, I don't know if you noticed the stopwatch there on the table.
Thank you.
Yeah, if you'll kind of click it when you start. We have 1, 2. Everyone gets the same amount of time. Thank you.
All right, can y'all hear us okay? Okay, started. Well, good morning. First off, thanks for having us. I'm Eugenie with Lockton. I live here in Lafayette. My team with me today is Kim and Shamika. And so we wanted to use this time to the best of our abilities to answer any questions you all may have. Obviously, we submitted the formal RFP response, and we set up a placemat just to sort of guide conversations. There's 2 different directions we can go in, so we'll look to you guys for what you feel like is the most important. The first side of the placemat has information more around our day-to-day support, how we would work with Lafayette, how we would build out multi-year strategies. And then the second side actually has what we felt like was the elephant in the room, right? The $6.6 million looming deficit, that's down from over $10 million from the prior year. And so we wanted to put together some solutions that we felt like could get Lafayette out of that deficit situation, and we could do so within a year. So if you'd like to spend the time today talking about how to solve the deficit issue, we can do that, or if you prefer, we can talk about how our teams work together and talk about deficit second. Does anyone have a preference or feel for what would be most important to this audience?
It's your presentation. It's your 15 minutes.
All right. I think we could, just based on the tone of the RFP and how many questions were surrounding the deficit, I think we should dive right into that, and then we can always wrap up with how our teams can work together. So I'll start us off on this page. Can we flip the screen?
You got it all mess around. Here.
Yeah. Maybe go down.
Oh, yeah, there we go. There we go.
All right, so we're on the second page of the actual placemat. The first column is your current state. So we wanted to just kind of talk about what Lafayette's doing today. You have uniform eligibility. Your retirees with Medicare can choose to be on the active plan or the Medicare plan. You have a triple option. You actually have 3 PBMs for your pharmacy program. You have wellness and well-being, and you have plan designs that have been around for a while. So I think that that's your current state. And so we wanted to look at what changes could Lafayette make that could actually fill that deficit, that $6.6 million target. When we look at those, we spread them from innovative all the way to reformist. All the way to the right is the most disruptive options that Lafayette could choose, but they also have some pretty tremendous savings tied to them. Again, we don't think you have to go that far. We think that you can solve your problems actually by just making some thoughtful decisions around how you manage your retiree population, thoughtful decisions around how you manage your pharmacy programs, and looking at your benefit plans. Can you drive your members to make better informed decisions as consumers? And those can be done. What we found when we looked at it, one of the recommendations we would have is around your Medicare Advantage plan. You have a very rich, wonderful benefit with Medicare Advantage. What we find, most groups like you have more of an education problem. Retirees don't understand it, they have questions or concerns, and so we feel like having a mandatory meeting where retirees are able to come and opt out of that program is a great opportunity to teach them about the benefits and let them make the informed decision for themselves and their family. We believe you could pick up about 40% of that population by doing those mandatory meetings, and again, this would be an opt-out.
I just pulled your microphone a little closer.
Okay.
Oh, thanks.
Thank you.
So again, you're looking at about a 40% migration. Once people are educated and realize that they can have a plan at no cost to them and the richness of the benefits, there's an opportunity there. The other thing we looked at was the Blue Connect plan. You can tier your Blue Cross network so that you can drive members to the lower cost, higher quality providers in Lafayette. And you can do that through your benefit spread. That looked at a savings of about $1.25 million by setting your plan up like that. I'll let Kim talk a little bit about the pharmacy because we felt like that's the opportunity when we compared you all to other groups that we have.
Sure. Hey there. Oh, there we go. Okay, good. I'm pretty loud anyways, but the microphone helps. So I'm Kim Commissar, Vice President of Pharmacy Consulting at Lockton, and my sole job, I know you all have a lot of hats with the benefits that you have here. My sole focus is pharmacy. So in looking at your current arrangements, you have it spread across 3 different vendors. And something that we found, I mean, even in the past year that Lockton's conducted 400 pharmacy RFPs, is that it's best to leverage your scale by pulling those lives together to get better pricing. And by doing so, you'd be able to save somewhere between 10, probably towards the higher end, 20% to get improved discount and rebate guarantees, along with looking at other terms of your arrangement. That's a standard thing that we would do within our scope of work, is that regular due diligence to do RFPs every 3 years to make sure you're getting the most competitive arrangement on the market. And then additionally, we wouldn't settle there. So that's the first thing that we would look to do, is using your scale, pulling it together, not to mention making it easier to administrate, but also looking at market checking that every year, comparing it against the market, and negotiating improved pricing annually. as well as doing regular reconciliation. So you get big rebate checks, or at the end of the year, you get a report from your PBM saying you get a check for we over or underperformed discounts. How do you know that that is adhering to what you signed up for in your contract? And that's standard work that we're able to do with our systems, is go claim by claim and make sure those are bucketed appropriately. We hope to not find anything, but oftentimes we do. So not only negotiating improved pricing, but also making sure that the terms of your agreement are adhered to. So those would be a few big factors.
But we saw that as probably the biggest opportunity when we looked at how the Lafayette plan is structured in pharmacy. Size matters. And so you all you are a large self-funded account. And what you've done is you've broken yourself into smaller pieces and then marketed those out to the PBMs. And in doing so, you lost ground in terms of being able to command better pricing, better terms. And that's an area where we felt like, without impacting members tremendously, there could be some disruption. That's something that we would quantify for you. How many people would have to change a prescription, or is there a pharmacy that's no longer in network? Those types of things we would look at and quantify, but the total savings is pretty tremendous. And to think that we can almost fill your deficit bucket by improving your pharmacy program, we feel like that was a good, easy path that would be something you could take without being incredibly disruptive. Yeah. As you go to the right, things become more disruptive and there's additional savings there, but we thought we have a pretty good plan here to tackle the problem at hand, to fill that $6.6 million deficit, and also set this, because that's not including trend, right? That's just where you're targeting. So also setting you up where we start to build back that reserve account. We feel like that's important. Year over year, being able to manage your plan without having to make hard decisions or do things mid-cycle is important. The other thing we looked at was the wellness and well-being. Shamika, did you want to cover that?
Yes. Good morning, Shamika Kraft. I am a Vice President Lead Consultant with Lockton. And we kind of look at the wellness and the well-being in a bucket where these are areas where you can impact kind of the population health and put some things into place to help with things like diabetes management, people that are suffering from high blood pressure. So Ochsner has a program under the Ochsner Wellness Program to where all members can receive wellness screenings so they know their numbers, they know where they stand as far as their blood pressure, their glucose levels. And then from there, we also have within Lockton our InfoLock database where we're getting claims data directly from the carriers, and we're able to identify those individuals for the programs like the digital medicine program through Ochsner, which anyone with high blood pressure or diabetes would be identified through that data, and therefore we can make kind of targeted decisions and have some strategy built around that. Estimated savings about $2,200 per member per year for those that are actually identified through that data through InfoLock for digital medicine coaching.
And then you want to talk a little bit about the plan designs?
Another opportunity within the plan is really kind of resetting the actuarial value of the plans. So basically, when there's an actuarial value assigned to the plan, it's basically saying depending on where that value is set, that's how much a member would have to pay out of pocket when they utilize the plan. We saw some opportunity within your plan to kind of have a better spread between each of the 3 plans that are in place and have impacting it by making some small plan design adjustments. For one, your ER is well under market at a $50 copay. A lot of groups have gone to, if not double that on the copay, deductible, and coinsurance, and the utilization for that also reflects that it's too low. $50 copay is probably closer to a specialist copay. So folks are not necessarily utilizing the ER for true emergencies. And then some small tweaks to the plan design would also generate additional savings. So we're looking at about $200,000, just making some small plan design adjustments and also adjusting the ER copay.
One of the things we wanted to point out is that we felt like these were decisions that the school board could make that were not hugely disruptive. They weren't negative in terms of the member experience, and they also filled the gap, right? So that $6.6 million deficit could be closed in year 1. Year 2 and beyond, if we start to move towards better consumerism, those tweaks could also help in terms of savings of like $1.25 million. Consolidating the pharmacy programs down even further could produce another $2.5 to $3 million. So we wanted you to be able to visualize how do we get you from point A, which is where you are today, to point B, to the future. And one of the things we do with all of our clients is build out multi-year strategies. So we don't just look at what do we do right now because there's a dumpster fire, right? It's, number one, did you know about it ahead of time? We project out, our actuaries project out a year in advance. So you know if you're going to have a $6.6 million deficit, you would have known this, first or second quarter of last year, and we would have been able to prepare for it. So again, having this mapped out, you don't have to do anything on this page. You can do all of it. You can do some of it. But we wanted to just show you that progression and show you that there are things you can do to improve your plan performance, to close that deficit so that you don't have to push rate increases or just make, plan design changes to make your plan work better and work for Lafayette. As you go to the right, of course, there's some things that are more in the bottom right, reformist. You could make a carrier change. You could move to United Healthcare. They have a great program that really boosts consumerism, and there's some additional savings there. But again, what can you do under today's umbrella, right? Staying with your incumbent and looking at that. We felt like those were some of the steps you might think about that are a little bit easier to think through versus doing something very dramatic. But the dramatic is there. If you lost a huge head count of kids or some type of severe budget crisis, there's some steps that we can take. And we did price those out. We did illustrate those for you. I want to pause there for a second. Are there any questions? I know we've covered quite a bit in the last 15 minutes. Any questions about?
Any questions? Yeah. I would prefer to save the questions till after the time is up, but if you guys want to jump to put anything in now, go ahead.
I have a quick question.
Sure.
On your, on the top line about retirees. Can you kind of go over your plan to handle retirees?
Sure. That's a great question. In fact, we focus a lot of attention on retirees. We work with a lot of government entities that have retirees, both early and then those that we consider post-65 or Medicare eligible. I would say that Lafayette is somewhat of an outlier. A lot of large self-funded school boards, cities, and other municipalities have moved away from covering retirees once they become Medicare eligible. Either they put them on a Medicare Advantage plan, or they have a Part D card, or they have some sort of, policy or procedure there. But most of them no longer cover them under the active plan. So that's a place where Lafayette definitely is doing something that we see as being different. There's a lot of cost there because the federal government will pay their claims through the Medicare Advantage plan. What we find with Medicare Advantage is there's a lot of misinformation. A lot of retirees have friends who are on individual Medicare Advantage. That's not the plan that you offer. The plan you offer is much more robust and rich. It has no network. You can see any provider in the country who accepts Medicare. There's no deductible. There's really not much of an out-of-pocket max. There's no co-pays. It's a Cadillac plan. But getting that information to the retirees and allowing them to ask questions, we find has been the biggest obstacle. So we do custom communications around retiree populations. We recommend separate meetings so that they can ask the questions they need to ask. We recommend touching them throughout the year with opportunities to enroll. And another suggestion we would have, you have Medicare Advantage with Humana. It's a great company. But your actives have Blue Cross. And so having somebody change from Blue Cross to Humana is an obstacle. So we would recommend that you look at Blue Cross. They have a Medicare Advantage program. If you had United, we would say look at United. But you have Blue Cross, and so their Medicare Advantage program we think could be very robust for your retirees and not as disruptive. So that's an opportunity that we would look at. Did that answer your question?
That does. Thank you so much.
We have 30 more seconds usually.
What's that? I've got about 30 seconds left. I would say, too, there's some contribution strategies some groups have used, other school boards have used, where they set premiums so that the Medicare Advantage, they pay for that, and then the retirees would pay the difference. So there's some things you can look at doing, but I think first and foremost, education around that plan is key. And every member you can migrate over, that's a member who's now going to have their claims paid by the federal government through Medicare. So that's a huge cost savings. We're winding down to the question and answer section. So,
Well, great timing.
yeah.
At this time, we will go into questions from board members. And I do have a few questions that I've written down because in the interest of fairness, I want to ask each company the same question identically. But before I do that, I'd like to ask my fellow insurance committee members if they have any questions.
I'm happy for you to go first.
Okay. So I'm looking at the nice presentation that you guys provided for us. Thank you. And it appears that, and correct me if I'm wrong, but it appears that Mrs. Kraft would be, because the title is lead consultant, Ms. Kraft, would you be the individual, the person that the superintendent and staff would be working with on a monthly, weekly, daily basis if needed, moving forward if you guys were chosen? Would you be the individual?
That is correct. So the way that we're structured, I lead a team, and there's about 5 other individuals that are on the team that would help to support, day to day. Eugenie and I work closely together on a day-to-day basis. She does a lot of the project management, and we collaborate on the strategy. But as far as your main contact on the day-to-day basis, that would be myself and my team.
Where is your office located?
I am located, I have an office between Dallas and our Metairie office.
Okay. In your specific practice, how many of your self-funded accounts that you currently manage are either with Blue Cross, United Healthcare, United Medical Resources, Aetna, Cigna, or any of the big carriers? And, I'm sorry, it's a two-part question. And how many of your self-funded accounts that you currently manage provide healthcare benefits that you negotiated directly with healthcare providers?
Yes. So as far as my book of business, between all of the accounts are between Blue Cross and United Healthcare. I have a heavy book of business in Louisiana, specifically in the government space. So pretty much all of them are pretty much Blue Cross, with maybe 2 with United Healthcare or UMR. And what was the second part of the question? I'm sorry.
Do you have any clients that any accounts that you represent, that you manage, who you have negotiated healthcare benefits on their behalf, self-funded plans?
Directly with providers?
Yes.
I haven't negotiated directly with providers. I know Eugenie has done some of that in our partnerships. I'll let her speak to that part.
I have, and we've built narrow networks, we've built custom reimbursement levels with different providers. I think it opens up, there's opportunity there, obviously, to negotiate with local providers. The challenge you're gonna have is that the BUCAs, so your Blue Cross, United, Cigna, Aetna, based on their provider contract terms and their systems, generally don't load one-off deals. So if you're interested in doing one-off deals, then we really need to look at a third-party TPA, someone with a little more flexibility. Now, I'll caveat that by saying the reason the providers are willing to do one-off deals with those is that their network discounts are generally not as robust as the Blue Cross, United, Cigna, Aetnas of the world. And so because they have less of a discount, they're willing to give more back because they're still kind of getting back to that level. So that's one of the things with a one-off deal. We would want our actuaries to take a look at it. We'd want to price out what's the difference between those networks and make sure we're not cutting off our nose to spite our face, because we're getting, let's say they give us a 10% better deal, but their deal might be worse than what you had before. Those are the types of things we had to get into the nuances and make sure that we're not doing something adversarial that sounds like it's a good step, but then all of a sudden we gave up, some of our savings. So again, we are able to do those. We have willingness. I know there's some providers in town we've already spoken with who would be interested, but it would be more to the right, that more extreme where we would need to move to a TPA. We would need to do some other things to back into that, but that's something we could definitely look at.
Okay. If you were chosen to represent Lafayette Parish and you find yourself in a situation where any healthcare organization of any type or insurance company provides you with any type of compensation whatsoever, commission, bonus, override, or any other type, will you immediately turn 100% of that commission over to Lafayette Parish School System?
We would not, and that's because Louisiana Department of Insurance regulations would consider that a rebate. So we would not legally be able to do that. What we could do, though, is we could use those funds to credit towards your fee and offset it dollar for dollar. So we can't write a check to Lafayette, but we can credit the fee. We do have clients that pay us a fee. We have clients where we make commissions, and then we have clients where we do a combination of the two. Under any agreement, the one thing we do every year is we fully disclose any and all revenue from any and all sources. And that is regardless of if it's reportable on 5500, if it's backdoor revenue, any of that. We put all of that on the table every year to every client, and we always have. And that was one of the reasons why I went to work for Lockton, was the transparency. I like to do business where if I'm your consultant, you know what we make, you know what we provide, and there's no hidden money, there's no agenda, there's no, well, we want to move you to this dental company versus that one because we get a bonus or something. We don't play that game, and so that would be fully disclosed. And under the parameters of the law, of what we can do, we can credit that back to you, or we can have you just where they don't pay anything on your account. Now, at the end of the year, we would like to just fully disclose regardless, even if it's something saying we got zero, from all your providers, vendors, et cetera.
I'm pretty sure that would be in the contract. And my final question is related to retirees. As you know, as you stated, as you discussed, we're one of very few organizations where retirees remain on our plan after retirement as opposed to another option. Given that, can you elaborate just a little bit, in the interest of time, just a little bit, can you elaborate on any real-life experience in creating ways to minimize risk from that population other than a migration to Medicare Advantage?
So Medicare is your friend, right? Because the federal government is paying those claims through the Medicare program. It would be like them coming in and offering to pay to build schools, and you go, no, we got it. We'll pay for that ourselves. I mean, it just isn't really done much anymore because it's become so expensive. I personally have worked through, we've customized meetings, materials. We've done, if you get the open enrollment booklet and it's this big, it's really difficult for people to read and understand. So we like to take the Medicare population down and treat them separate because they are. They have different options, and so that's what we would do is there's a lot of hand-holding, a lot of meetings, a lot of things to educate the population. What we found is that once people move from the active plan to the Medicare Advantage plan, you almost never hear from them again. And that's a good thing, right? You don't hear complaints, you don't hear concerns. They love the product, but getting them to take the chance is the tough part, right? And that we close that gap with communication, meetings, and having the right people in the room to answer questions, because there's so much. And I get this. I mean, I have family members who are retirees of the school system, right? And they're like, what about this Medicare? I said, it's a great plan. You're wasting your money on premiums if you stay on the active plan. But that's a one-on-one conversation. So we like to expand that, and we have a team that does custom communications. So we tailor that to the retiree population to help you.
All right, Jeremy has an insurance background, so his questions are going to be very different from mine. As Lafayette Parish School System is the largest employer in Lafayette Parish, I care very much what our employees and retirees experience working for us. How many, with Lockton, how many employees do you have living in Lafayette Parish currently?
Living in Lafayette, I think we have 3, including myself. And then across the state, we have a lot more. We have offices here, Baton Rouge and Metairie.
Okay. If you were to win this contract, do you see Lockton moving more people to this area, or is everything online now? Can you help me understand what that would look like if you win this contract? How would it shape your company, or just tell me what would be your next steps in the people resources?
Sure. So we have on the first page, there's a couple of pictures here of some folks that would work directly on the account, from compliance, actuary, health resources, our medical directors. We employ over 700 employees who do nothing but employee benefits. So we have every specialty, subject matter expert. Shamika is your quarterback. So she has access to all the folks. She pulls them in as needed for meetings. In terms of connectivity, we maintain 24/7 connectivity. All of our team members have laptops, cell phones, et cetera. We are continuing to build and grow in Louisiana, and we have a number of open positions. So we don't need to staff up to handle Lafayette, but again, as we continue to grow our footprint in Louisiana, we're always looking for talent. I see some in the room today. So, we're always looking for good people to join our team, and so we will continue to do that. But I won't talk to anyone yet, but anyway, yeah, we're always looking to grow. We're always looking for good people, and I know Lafayette has a plethora of talent here. So bringing on additional people is something we'd be open to, but not something that would be necessary to manage the account.
Okay, thank you. I'm glad we're all being very honest here.
Very candid.
Okay, so do you have a centralized call center, and where is it located?
We do. Shamika, do you want to talk about benefit assistance?
We do. We have a call center that's located right in our Dallas office. They're downstairs from me, and we've actually just expanded on that call center. So the beauty of having it right there internally, we don't outsource it overseas or anything like that. Is if there is a kind of an escalated issue, I can go and knock on somebody's door to get that handled. But I work in conjunction with the call center manager that is located in the Dallas office.
Okay, that's great to know. And then one of the things you talked about was, with the possible, looking at different percentages of migrations, and you stated that retirees seem to not understand, the different plans and, going to Medicare, that it would cover everything without paying a premium. And it really just came down to sort of bad education. So how would you incentivize? Do you have some sort of incentive to get these members to come be educated? Because, it's a two-way street. We can put it out there, but how do you have different methods in incentivizing, attracting people to come understand what's going on?
We do. In fact, the first column, I put mandatory Medicare Advantage opt-out meeting. And so by doing an opt-out meeting, you require retirees to come to the meeting, sit through it, get educated about the Medicare Advantage plan, and at the end of the meeting, if they decide that that plan's not right for them, they would sign a form saying that they wanted to remain on the active plan. There's another large school system in South Louisiana that did that, and they picked up about, I think it was over 90% of the retiree population moved over to Medicare Advantage after attending the meeting. And that's because Medicare is very complicated. Your group Medicare Advantage does not operate like the individual Medicare that people see advertised every year in the fall. Most of their friends have it, and they say, well, my friend's doctor doesn't take Humana. Well, that's not the Lafayette plan. You don't have a network, but you have a group policy. So it's those kinds of nuances that are very difficult. It's almost like a one-on-one conversation. So first and foremost, we would say do an opt-out meeting. So retirees still have the choice. You're not forcing anybody to make a change, but you're having them come to get the information so they can make the best decision for themselves. And then from there, in prior years, if you need additional push to move more folks over to Medicare Advantage, you can look at how you set those premium contributions. So Lafayette could pay what you're going to pay for Medicare Advantage, and the retirees could pay the difference if they want to stay on the active plan. There's other school systems in Louisiana that do that. Some of them just say you're no longer eligible, and others will do where future retirees, so after effective January 1st, anyone who retires and they're Medicare eligible, their option is only Medicare Advantage. So there's several things you can do. Each of those are going to have a pretty significant impact on your GASB unfunded liability, as well as your just hard cost of your health plan. But those are steps you can take. And again, that education, once people go to the meetings, they hear about the policy, they're able to ask questions about their specific drugs, their specific doctors, it dispels some of that fear of making a change. And then we mentioned earlier the change itself, right? If you were to have Blue Cross Medicare Advantage, going from Blue Cross Active to Blue Cross Medicare Advantage is an easier path than making them change to a whole new company. Not that Humana does a bad job, they do a great job in Medicare. But again, those are some of the things that we would put on the table.
Thank you.
I do have one follow-up for Ms. Kraft. My fellow board member asked a question regarding call centers. This quote that you guys submitted, that you guys were asked, the information is asked for is for a consultant, not a broker, not an agent. So keeping away from being an agent, keeping away from being a broker, and truly being an independent consultant without any conflicts at all, what is the value or the necessity for a call center?
Shamika, I can jump on that one. I'll answer that just because I'm aware that you all already have a call center. You have a benefit administration company that handles your enrollments every year. So if you were to use our call center and their call center, that would be duplicative. And so we would say, if there's a problem with your enrollment firm and you want to look at another call center, we would engage our group in Dallas. But otherwise, we would say that wouldn't be necessary because your members are already calling a call center that you have established today. Now, in terms of working with your team here, Shamika's available, I'm available, and we answer questions and comments and calls. We get involved if there's a claim issue that's not getting resolved with the carrier and that type of thing, so more of like an escalation. But does that help kind of clarify how the call center would?
Yes.
We have it, so we can check the box that we have one, but again, when we look at how you're structured today, I don't see the value in putting it there. I think it would actually be confusing.
Any other questions from board members, from committee members?
No, I'd like to thank y'all. You know, very informative. Appreciate y'all coming.
Thank you.
Thank
Appreciate
you.
y'all
Thank
having
you.
us.
Thank you for your time. A couple of housekeeping things that I failed to mention before. If, during your presentation, if you ask board members for questions, that's going against your time. So you have 15 minutes to present. We will definitely ask questions you heard after the presentation. If you feel like you're done and you have 3 minutes left and you want to ask for questions, feel free to, but your time will continue running. Also, with the questions, I understand that this is a very complex topic, but if you don't mind, be very brief and concise in the interest of time for everyone. Committee members, do you have a preference on who we call up next? Okay. Gallagher, if you would please step up to the table.
Should be up. Let me know if not, you can just scroll. Okay. Do I need to?
The timer.
I need to bring it like bigger up
You can. It's got the plus and minuses on it.
or just go next.
You can just scroll through,
Oh,
page
I got
through.
you. Okay.
You
It's
can
not like
increase it with the
PowerPoint.
increase at the bottom.
Okay.
Timer is
Right here.
And I believe that they got it up there too. Yes, ma'am. Do we push the button to go?
I don't think so.
Okay, great, thank you. My name is Melody Terrell, and I'm a senior benefits consultant. I sit in the Covington, Louisiana office. I'm also area vice president. Today, before we say anything, first of all, we've come with a very large team. We're very honored to be here, and we thank you for that. As you can see on this slide, we have an awful lot of experience in the K through 12 space. We represent a lot of clients and have for many years, and we're hoping that we have that same opportunity with you. In the spirit of time, I'm not going to introduce all of our team members. I'm going to allow them to do that. However, I would like to call out that we have 3 of the 4 local people that would be servicing your team on a regular basis here with me today. I have Tony Murray, who's a financial analyst. I have Matt Ardwin, who is a benefits consultant. And I have Angie Landry, who's an account executive who will be serving you on a regular basis. We think that we bring an awful lot of great value to you because we do have subject matter experts. Years ago, it certainly didn't take a team or a posse of people to control healthcare costs. That comes with, flip to the next slide. We have specialists, subject matter experts. We have actuaries, pharmacy team, clinical team. We use business intelligence, and last of all, but probably most of all, we believe in a great service team. The next slide basically talks about a survey that we've conducted. It's one of the largest surveys on a national basis. This survey shows that a lot of the things that were called out in your RFP are also subjects that all school districts are concerned about. There's a huge emphasis on the budget, forecasting, and of course, how do you control the budget and do you get an accurate forecast? Saying that, there's some specifics that we think that we can identify and go over with you to help you control your costs. And with that, I'll let Kim Briard speak.
Yeah, good morning, everyone. My name is Kim Briard. I'm also a benefit consultant here with Gallagher. Actually, Eric and I, we are going to just spend a couple minutes. What we did was we identified about 10 trending strategies that we took from the data in your RFP. So, I know we have a limited time, we can't go into a whole lot of detail, but wanted to talk about, just a few of them. I'm going to start with the Inflation Reduction Act. That's a regulation that is going to really impact your health plan due to the amount of retirees that you have on it. We want to let you know that our team is equipped to be able to discuss how this is going to impact your current budget today and any future budget that you need to consider. We're going to be able to make plan design recommendations to make sure that your plan is in compliance with the regulation, but also some strategies around mitigating the cost that this regulation is going to have on your plan. The next topic that I'm going to discuss is the dependent TPA, PBM, and claims audit. We're really passionate about making sure that, on a regular basis, you are conducting audits on your plan. With a $76 million spend, it's a huge spend to make sure that your claims are being processed correctly. You have eligibility requirements. We want to make sure those contract terms are being handled that way. What we've seen in the audits is that just a few claims that are processed incorrectly could potentially save the plan hundreds of thousands of dollars. So really just making sure there's not a lot of waste in there. Outside of those audits, what we regularly do is we request that we have intel into any claim that's filed with your workers' comp carrier, right? We want to make sure that there's no double dipping there where people are filing workers' comp claims and you're paying claims under your medical policy, again, to avoid the waste in your medical plan. And then lastly, I'm just going to talk about just the employee engagement experience. We know that there's some issues around mental health and burnout in your workplace, especially in the K through 12 space. So making sure that your employees are engaged in the programs that you have. Currently you're offering an EAP and a wellness program. We are confident that we can increase your participation in both of those programs. What is that going to do? That's going to lower your claims cost level, and you're going to have a more engaged, productive employee. Eric?
Okay, thank you, Kim. My name is Eric Pearson. I'm a area senior vice president with Gallagher out of the Baton Rouge office, but born in Lafayette, so good to be back. I'm going to touch on 4 topics on the trending strategies. The first one being high-cost claimants and clinical management support. We provide clinicians and nurses to assist members who are potential high-dollar claimants in an effort to mitigate those claims. We also work with outside vendors. We call them point solutions on your top 5 disease states. So diabetes, hypertension, COPD, asthma, and obesity. We engage them and ensure that they're getting the highest quality of treatment to help mitigate those costs and keep quality of care high. We also evaluate high-performance networks with Blue Cross, United, any of the vendors, where providers will provide a low reimbursement for potential steerage to their facilities. So we evaluate those on a regular basis as well. And the last thing I want to touch on before we turn it over to Daniel Lease is COBRA participants. We provide a service where we can assist COBRA participants with education for the public exchange. In a lot of cases, the subsidy that is provided in the public exchange provides a lower deductible and a lower premium cost than that of COBRA, and COBRA claims stay with the group. So getting those folks off of COBRA or showing them another alternative can help keep costs down, and it's better for the member. So I just want to touch on those 4 points on ways in which we keep costs down on behalf of our clients. Okay.
It's like we're playing musical chairs. We appreciate this opportunity, and thank you so much for giving us this time.
Good morning. My name is Tony Murray. I'm a financial benefit consultant. I live here in Youngsville and work out of the Lafayette office, and my main focus is public entity and school boards.
And my name is Daniel Lees. My background is statistics. I stare at Excel all day and play with numbers, and my wife teases me because I do this, but I love what I do and enjoy our job. I see up a team across the U.S. that we call our business intelligence and data and analytics. So it's really a lot of fun when it comes to data, and we've kind of shifted our approach over the years as we look at how Gallagher interacts with our clients. Historically, we would come in there and say, Gallagher's great, and pat ourselves on the back, but we don't want to do that. We want to come in there and say, hey, how can we truly be a partner and collaborate and really drive home what are the goals and needs of the organization? So we developed something called Data Drives Decisions. I like to tweak it a little bit to say data-driven consulting, right? Really partnering with our organizations. As we go into that, we really start, I want to say 3 prong here. So we're going to let's look at the population, their location, geography. Let's understand the population. 2, let's understand short-term and long-term goals of our organization. Let's really talk through that. What are we setting out to achieve short-term and long-term, and let's put a strategy in place. Then lastly, let's look at what's existing today. What's working well? What tweaks do we need to change? What do the numbers show? What does the benchmarking look like? And assessing that. We'll go through and assess that through some of our tools that we use and leverage. And going forward, then we put together a plan. Let's develop and optimize a strategy. But we don't want to end there. And this is where I feel is very important as we discuss this, because we could come out and throw data. We could develop strategies, point solutions. We want to also hold ourselves accountable. We want to measure what we're saying we're setting out to achieve. We want to make sure we achieve those results. I could throw data at you and say, here you go, and we could get lost in data. But at the same time, we want to have that consulting approach and say, this is what we see. This is the data supporting what we're seeing, and let's monitor it in case we need to make a tweak along the way. And that's really our data-driven approach. As we go into that, looking at your plans, and we appreciate the information that was shared in advance, we want to show some preliminary numbers, results. Obviously, we want to refine these, and we are conservative with our approach as we come and present the findings. From this, we're looking at pharmacy. Really diving into your pharmacy contract, your marketing. GLP-1s is a hot topic. This is going to be those Ozempic-style drugs. Understanding those contracts in place. Really understanding the formulary list that's set out. How do we control costs, but yet still have the appropriate care that our members need, that the patients need at that level. Really diving into that. We have our whole pharmacy specialty team that even one of those individuals used to write these contracts. And so we know exactly where to look and dive into those details, ensuring the potential savings of almost $2 million. Again, being conservative with these preliminary numbers. We'd always refine our assumptions as we get more data. Again, you're gonna hear me say data a lot. So Surgical Center of Excellence, another opportunity, looking at individuals. Musculoskeletal is often a high-cost diagnosis that comes up on the plan. Diving in the Center of Excellence is making sure we're steering people to appropriate doctors, physicians, board-certified license, and avoid readmittance or complication of surgeries. We want to make sure they're taken care of, right? And identifying that helps avoid the readmittance and unnecessary costs that may hit the plan due to those complications. Next, we're going to look at chronic condition management, hypertension, heart disease. How do we appropriately make sure that our individuals are getting the right treatment of care, the right drugs, making sure that that's appropriate and that they're being monitored through that process, and have almost like a second opinion, second doctor, kind of assisting to making sure in conversations to have. This is another great opportunity to really take control and have more of a hand-holding approach to our members on the plan. Next, we like this one a lot, is a Go to Doctor campaign. Think of a wellness style campaign. There's different opportunities for wellness. When we look at different strategies, I usually say there's 2 main things. You got cost and savings, and then also disruption. Can we disrupt and make a lot of noise? Absolutely. Can we save a lot of money? Absolutely. Do we want to do that? Absolutely not. We want to have that conversation and collaborate together. But what can we do that minimizes that disruption and that noise? So Go to Doctor is when we encourage people to establish that patient relationship. We've tracked this. If there's not a good program in place, that we look at the utilization, getting their annual physicals, checking in with their doctors. You feel more accountability when the doctor says, hey, you're not eating well, you're high blood pressure, you need to take better care of yourself. Having that accountability, avoiding the ER visits. We would monitor those metrics to say, this is what we do, this is the plan we want to put in place, but let's incentivize people. Maybe we adjust contribution levels. Say, if you're taking better care of your health, we're going to incentivize you. We're going to give you some money back, but yet we're going to see those savings in the long run. More of a long run approach as we analyze and have a wellness culture around that. Lastly, another option is dependent audits. Again, these are some of those low-hanging fruits to say, all right, over the years, people's change, households change. Unfortunately, sometimes there's divorces, et cetera. Some people may not be eligible for the plan, but having those dependent audits to really come into play to say, all right, let's make sure those on the plan are truly eligible for the plan and that we're spending our money wisely and doing our fiduciary responsibilities and control through all of that. And then we jump into our financial and actuarial support and underwriting. This is also crucial as we go into that because we're going to do fiscal year projections. We recognize there's a fiscal year. There's also a plan and annual year. We want to make sure as our actuaries work with you to dive into the data, set up contributions, plan design modeling, looking at discount analysis, certain care providers, if we do medical network marketing, all of these things we're going to take the appropriate steps to make sure you're getting the data in front of you to make that decision, to have that meaningful decision, but having the consultative approach as we come and sit side by side with our teams and have those discussions to say, let's align our goals, let's work together and truly partner together as we move forward.
Good morning. My name is Lana Labradette, and I'm a service consultant with Gallagher.
Hi, I'm Angie Landry, and I'm the client executive with Gallagher. I am from Milton, and I'm housed right down the street in the oil center.
So we are dedicated to collaborating with you very closely on a short-term, with preparing short-term and long-term strategies. Our service calendar will measure our ongoing service and allow you to track our performance. The service calendar is a flexible working document that will evolve based on discussions that both Gallagher and Lafayette Parish have together to ensure that there is alignment with your goals. Your local Gallagher team is always available by phone, email, outside of scheduled meetings, and will serve an extension of your team. And this is a snapshot of this deliverable is included in every deliverable we meet. We also have a proprietary management system that builds out every one of these items into our service system for our team to follow and track. That way you can measure our performance throughout the year.
They only gave me 15 seconds. Okay, so in closing, we just provided what our fees are, full disclosure. I think, Mr. Hidalgo, you mentioned that. Before we take any compensation, we notify your team that compensation is coming. We don't do it after the fact. Eugenie did describe some of the Louisiana law and how difficult it is, especially on an override situation, in not taking that compensation. But certainly what we would do is we would notify you and it would be given back. Other than the overrides at the end of the year, I can't think of any other reason why there would be any compensation at all other than what we've disclosed. Transparency has always been a big deal to Gallagher, and we have it's one of our Gallagher tenets, and we've enclosed that in our proposal as well. We appreciate it.
Thank you.
We look forward to the possibility of working with you, and I guess with that, we'll open up with questions and answers.
Yes, ma'am. I will skip my fifth question and consider that to be the amount of time that you've answered it. Could you tell me who on your team, who here would be the individual that the superintendent and his staff would be working with on a monthly, weekly, daily basis as our consultant, should you be awarded the contract?
You know, it's interesting that you asked that question because more recently we were awarded a school board, and they really didn't want the consultants at the meetings. They really wanted more of the service team at those meetings. So we get to know you, we collaborate with you, we share with you what that team really looks like, and then based on maybe the subject matter or based on what you're looking for in that meeting, you'll make that determination. But your team will get to know all of these people. But for that particular account, it's Lana Labradette and Tony Murray. Kim, myself, and Eric are not typically at those meetings. I think in the last year, maybe we've met with them 4 times.
Okay.
They're very satisfied with that level of service.
And I appreciate the response. However, because in this specific case,
okay,
we are very specifically, without a doubt, looking for a consultant, not a broker or an agent or someone who's going to service ongoing issues internal that we handle. We're looking for an independent consultant who is going to advise us on how to get out of this $10+ million hole we're in. So who will be the person that will be the point person that will communicate directly with the superintendent and his team on a very regular basis?
On a very regular basis, it would be Kim, myself, and Eric.
Okay, great.
You would have 3 consultants.
Great, great. Remind me where each of you are located, your offices?
Covington, Baton Rouge, and Baton Rouge.
In your specific practices, how many of your self-funded accounts that you currently manage are with either Blue Cross, United Healthcare, United Medical Resources, Aetna, or Cigna? And how many of your self-funded accounts that you currently manage provide healthcare benefits that were directly negotiated by you or your team with healthcare providers?
Eric, would you like to?
Sure. Yep. So I would say that the majority of our business is with Blue Cross and United on a self-funded basis.
If
Again,
you don't mind, I'll need you to speak directly into the microphone, only because we're streaming online.
Sure, okay. Yeah, the majority of our self-funded clients are with Blue Cross and United. From a direct contract standpoint, we have been involved in some of those, but we do it in partnership with the TPA or the carrier. A lot of the carriers now, as we mentioned earlier, have high-performance networks where they work closely with the local providers to improve on quality, and they get higher reimbursements for that. But also, some of the providers are willing to give a lower reimbursement for steerage and to send more patients to their facilities. So we just work with the TPA or the carrier in those negotiations.
Any further response?
No, I would have the same response. I mean, the majority is with Blue Cross and United. I guess I would just add that, we are familiar with other TPAs outside of those BUCAs. Third-party TPAs are becoming more of an option, but when we go to market, we evaluate all of them, right? But specifically the ones that would meet the needs of your organization.
And I guess just to add to what Kim just said, you can negotiate within those carriers different networks. So it could be that we would evaluate Blue Cross, but we would evaluate with our network specialist which network might provide the lowest discounts.
Okay. Thank you. And I misspoke. I'm going to omit the 4th question. The 5th question is, as you know, I think you've alluded to it as well, we're one of the few organizations where retirees remain on our existing plan when they retire, as opposed to being forced into another option that most organizations do. Given that, do you have any real-life experiences outside of what you've already described in creating ways to minimize risk from that population other than a mandatory migration into Medicare Advantage?
Yeah, so again, we are very heavily involved in a lot of municipal groups that have, retirees such as yours. And, there are strategies that you can consider outside of migration to a Medicare Advantage plan. By far, the Medicare Advantage plan and you moving them is going to create the most amount of savings that we have seen. But, looking at your formulary design, really attacking your drugs, your copays. I mean, we know that, for every $100 deductible that you put on a plan, you're going to save about $4 PEPM for that population, right? So there's design changes that you can make. There's things that you can do with your drug wrap network on the Medicare Part D side that could, lower the cost for that population without a total migration.
And I'm going to add, and then I'll let Eric add, and now you know why we have 3 consultants. It's complex. It takes a lot of thinking, and even as she's talking, I'm thinking, and as I'm talking, Eric's thinking. One thing that Daniel didn't speak to probably enough, because we have a limited amount of time, is population health. So what we do is we take your data and we analyze it based on what he said, based on zip code, based on age, and then what you do based on that population, you try to create better outcomes. You do it for the participant, for the patient, because it makes them more healthy and they have a great lifestyle. But as it relates to the health plan, what we're trying to do is we're trying to create initiatives that can help turn around that condition. So we're detecting claims early on. And individuals that are 50 to 65 and 50 to 40, they have different needs and they have different conditions, and you can predict what those conditions are going to be through that data. And then what you do is you implement programs in which can help complement their health.
I think the ladies covered it.
Thank you.
Yep.
Ms. Mason?
I'm going to ask some of my same questions. How many employees do you have working in Lafayette Parish? I think you said 3. Is
We
it
have
more?
four employee benefits specialists that sit in Lafayette. However, we have, I think, 25 employee benefit people in Lafayette, but they're not assigned to your group.
Okay. Okay. And do you have a large call center? I know that this is not what Jeremy alluded to earlier, but it just is a question of mine.
Yeah, absolutely. We all probably have large call centers,
I hope you all do, but I would like to know how large and where is it?
Yeah, so within Gallagher, we have what's called the Benefit Advocate Center, right? So designed to handle member advocacy questions. So members calling in when they have, situations like I lost my ID card, I have a claim issue. Those are all US-based employees. They are Gallagher employees, W-2 employees. We do not outsource that resource. We do provide it to all of our groups. We have 2 platforms of services. We have our standard platform that we provide to you, and then we have an enhanced platform that it could be available to you. Knowing you already have that as a resource, we certainly can look at, how that would complement, your existing call center, or, we do not have to implement it at all. What's great about it is that it is multilingual, so there are, different languages that can support your employees wherever they are. It's outside of the normal business hours, which is a great resource as well.
Okay, and how would you be incentivizing members to come be better educated in the benefits that are available to them, or the plans that are available to them, especially facing, different suggestions of a migration?
Yeah, Lana, you want to take that?
I think what we do is when we look at different populations of our clients, we're really looking at those different age demographics and what's the best way to communicate, right? With the clients that I have that have larger retiree populations, most of those folks may not have email. They either want to be reached out to via phone call or by mail. Some of them don't even like their mail to be sent to their homes, and they like it to be sent to a P.O. box. So you have to understand the population that you're trying to communicate to. We have multitude of ways that we can communicate with our employees and retirees. We have text message capabilities. I actually have a group with a retiree population where I make a phone call outreach to every retiree that's approaching the age of 65 every month throughout the year, and speak to them on the phone. So it's really analyzing what is the best way to communicate this particular product or change to this population, and we certainly have all those means.
Thank you so much.
Do y'all have any experience working with other school systems in Louisiana?
Yes. We have several that we work with.
Any of them comparable to Lafayette Parish?
Yes, so one of the slides that you have does list a couple of them. We didn't put all of them. We didn't put a comprehensive list, but this team specifically works with St. Tammany Parish School Board, which is very similar to your size, along with East Baton Rouge Parish School Board.
And besides Medicare Advantage, do y'all have any other recommendations for retiree health care?
I think they've already been spoken to, but it's plan design, different contributions, And once again, wellness programs and what we call chronic condition solutions that help drive those claims costs down.
Okay, thank you.
That'll be all, Mr. Lejeune?
Yes, sir.
All right. Thank you so very much for your time. We appreciate it.
Thank you.
Next up, Assured Partners, if you would come forward to the table.
Oh, no, there's three. Thank you so much.
Go down? Yeah, just page down.
Yes, you got it.
Pretty sure I find my page down button. All right, so I guess you have to hit the stopwatch.
I'm going to hit it
First page down.
right now.
All right. Okay, cool. All right, we good? All right. We make sure we get this clock started. All right. Hey, appreciate the opportunity to participate, as I like to call the fastest 15 minutes in insurance. I'm Dave Matthews with Assured Partners here in Lafayette, and I've got Lori LaFranco and Susan Vogt with me. They're part of our specialty schools division, which you'll see in our RFQ, as well as today in the presentation, division called Keenan. We're part of Assured Partners, wholly owned 100%. All right. So today, we've got a little agenda, but basically what you're going to hear from us is two things: power through partnership and day one ideas, because that's what you guys are looking for. Hit the ground running. All right, so Assured Partners, I think everyone's got a story to tell. Our story started here in Acadia Parish, specifically in 1955 with a postman named Bennett Landry. And we migrated to Jefferson Street in 1987, and where we've remained in the Chase Tower since 1987. Obviously, in 2014, we joined Assured Partners. Our owners at the time felt that, with their commitment to Lafayette, Acadiana, Acadia Parish, Lafayette Parish, everywhere in between, that they wanted the opportunity to, deliver big things to the community and leverage opportunities that we have. And the best way we figured out to do that is through, partnership with Assured Partners, and then subsequently today, how we've worked over the last 10 years is partnerships with the other resources inside of Assured Partners itself. And so I'm going to let Lori tell a little bit about our specialty division and the power of partnership that we have with her organization internally.
Good morning, everyone. Thank you so much for allowing us to present. And I just want to say happy 4th to everybody. This country that we live in, this beautiful country, celebrating it. So I hope that you all enjoy. Thank you for this opportunity. So Keenan is part of Assured Partners as well. So we all work together. We have over 200 agencies across the United States and internationally. So Keenan started, we are 51 years old. We started with schools. So we have 850 plus school districts as clients. We're public sector focused, so we have 200 public agency clients, and then we have 100 hospitals. So this is kind of the niche that Keenan focuses on. We joined Assured Partners in 2017, so we're part of the partnership. We have 725 employees that provide everything, all the services, basically you've heard today, actuarial services, underwriting, we have wellness division, we have individual plans, the whole gamut. So I'm going to turn it over to Susan, and she's going to talk about our service.
Thank you. My name is Susie Vogt, and the K-12 space is my specialty. I used to work for the largest purchaser of health plans in the nation. Just came back to Keenan, was at Aetna as a vice president, and decided to come back and really help schools. That's really where my heart is. My children are teachers. I have a few children that are teachers, so I know how important education along with healthcare is. We have a really great service team approach. We do all the hands-on, approach for Lafayette and reduce your administrative burden. One of the things that's really important to me, you're the largest, employer here in this city. What's important to me is when you go into the hospital, your ID cards, everything, down to your ID cards, are branded when you walk into the hospital. They know where you're coming from. They know who you are. They know this is our school district, and they're super important to us. We do benefit booklets for your employees and those that do not have a computer. They look like a little magazine. We make sure everybody has them. We have a dedicated COE, so Centers of Excellence, claims resolutions, benefits, questions. I would be here a lot. I would be here probably the first week before open enrollment with private one-on-one appointments, meeting with people, meeting with retirees. I like to do a lot of webinars. I like to put a lot of webinars on your website so your retirees can go back and watch them. To me, retirees are the most important aspect of your school district. We're all going to be retirees, right? So we all need to be taken care of. So early retirees, and your active employees, super important. We do a lot of population health management, quarterly reporting, and then, we ensure that all deliverables are met and our quality standards. It is so important, and we stand by it. You will have a senior consultant, a communication consultant. We will actually brand your own website along with your help. You guys decide what pictures are on it, what you want to be on it. We can add things to it. So, we just make sure, and then we have relationships with all the carriers. So all the carriers. So I know you guys talk a lot about Blue Cross, and we do have relationships with United, with Aetna, with all the other carriers. And we make sure that we go to all carriers to make sure you guys are getting the exact benefits that you deserve. And I'm going to hand it on over to Lori.
Yeah, well, just quick, I guess I can answer Mr. Hidalgo's question on who's the team.
Yeah.
And us four individuals right here are your team. You're any of the board members, superintendent, administrative staff, we're the four individuals. Sandra Moro, unfortunately, was not able to be here. She's had a 2-year vacation planned that with the bump up by a week, so she wasn't able to attend. But we've, we're here locally. Susie and Lori. Lori's in Texas, Susie's in California, but here available at all times for you. So a little bit about scope of services, and Lori's going to talk about that.
Thank you, everyone. So I know, Superintendent, you've talked about your core values: safety, culture, opportunities, and growth. And one of the things that we're really proud of at Keenan is we have Keenan Safe Schools. So basically, we have a Safe Schools program that is widely used. It's education, webinars, we come out, but it's just really to keep our students safe. And widely used, we do a lot of schools and charter schools there. Your culture, so your culture can really be changed by your benefits, and people don't really believe that, but your benefits can change your culture. And, when employees feel like, look, my employer has my best interests at heart, they're looking for the best out there, they're looking for what's going to take care of me, and they feel taken care of, that changes the culture of the organization. Opportunities. I mean, obviously, you want to give opportunities to your employees. My background is all in the public sector. I was an HR director for a city for a very long time before coming to Keenan. But think about growth. Benefits really affect your recruitment and retention, right? I mean, you're competing for the best of the best. You want the best teachers. You want to recruit and retain the best people. Well, part of that is just not just what they make, what their salary is, but what are you offering them in benefits, right? It's a whole package. And you want to make sure that you are the most competitive school district to attract the best teachers. And then you think about your teachers. They're educating students, but who is educating your teachers? Your teachers want to be educated too. They want to be educated in what's being offered to them. They want their questions answered. They want to make sure that they have an advocate they have an advocate when they have a problem. If you're a teacher and you're teaching, then you're grading papers and you're trying to take care of a class. You don't want to sit on hold for an hour to wait for somebody to talk to that doesn't even know how to answer your question. You want experts. You want 24/7 availability, and that's what we have, a 24/7 emergency line, so that we understand that people don't just get sick 8 to 5. People get sick on weekends, holidays, and nights. We want to make sure that we have something available for your retirees and your employees around the clock. Because, and we, as we keep our cell phones on, we have, our clients will call us, text us, weekends, we are there to help. So we want to make sure you understand that this is not a Monday through Friday, 8 to 5. We do not look at our job in that way. We definitely would be involving you in what we call our centers of excellence. Our center of excellence is a whole team of people that are there for your retirees and your employees. And basically, like I talked about the call center, we also have an escalated claim resolution. When they call in, they're not just going to get a random person, but they're going to be directed to the last person they spoke to the last time they called. So their number's going to be recognized, and they're going to get the same person. Because a lot of times it's frustrating to try to explain your situation a second time. So anyway, there's a lot of services there. We have our own TPA, we have our own pharmacy division, we have our own actuaries, our legal staff. So I just want to tell you a little bit about us. Thank you. I know I'm talking fast, but I'm trying to get through 15 minutes.
We want to get through this 15 minutes. One of the important things that we picked out in the RFQ was, get ready to get started immediately. And so we kind of come up with our own little slogan here in day one ideas. And so we've got 3 day one ideas that we're going to try to answer, give you a high level overview in 4 minutes and 47 seconds. The first one that we're going to talk about is a program that is called Complete Care. Complete Care is a medical expense reimbursement plan. I guess the easiest thing we need to know is that costs are on the rise, and no one can deny it. We absolutely know that. What we also know is that Americans are not prepared for the cost of a medical emergency, and these are just stats there. And so what we've worked to develop over the years is a program called Complete Care, which is an incentive program that gives your employees another option, another plan to enroll in. But instead what this does is it allows them to enroll in their spouse's plan and cover up to 100% of the out-of-pocket expenses under that plan, as well as any premium differential that they may incur by moving to that program. So we know that Lafayette Parish School System is self-insured and has a $525,000 liability on every single man, woman, and child that's on this plan. This program, it allows your organization to transfer the liability while providing your employees with a robust benefit. So we like to call it a win-win, right? You as the employer, you're transferring your risk, limiting your liability from a cost standpoint. It's a win-win for your employer, for your employees, because obviously they have the opportunity to reduce their utilization because the deductible and the out-of-pocket could be less under that program, as well as the premium. And then secondarily, the final level is your employees, right? We're going to give them a plan where they don't have a deductible, they don't have a copay, they don't have an out-of-pocket. And if there is any cost associated with joining that other plan, we're going to help with them with that cost as well. So just simple, right? We've kept these in here, easy enough to say, current plan, let's say you've got a $1,250 deductible, $500 copay, prescriptions, you're not getting any reimbursement. You move to the other plan, you have an opportunity for a reimbursement. I'll let you guys read that after because I know our time's clicking and we want to talk about a few other things that we have available to offer. So I think the last thing I want to touch on, your max liability under this program. We're going to reduce your liability as a school system on these individuals from $525,000 to a max of $18,900 for a family or $9,450 for a family. So we can all put the pen to paper and know that is a huge reduction in your potential liability. All right? Susie?
Yeah, and I was going to talk about our Keenan Pharmacy services really quickly. We do have our own Keenan Pharmacy, although we have relationships with all the other pharmacies, CVS, you name it. We do have our Keenan Pharmacy Purchasing Coalition and our Keenan Pharmacy Clinical Management, which has a plethora of savings. But I'm going to let Lori talk because we think retirees are really important here. So Lori's going to switch on over to our Retiree First solution.
Thank you, everybody. So we love retirees. One of our retiree groups, actually in California, is the city of Los Angeles, 18,000 retirees. We just manage the retiree population. And so we work with a company called Retiree First, and they have been in they have been in business for many, many years. They started out with the Teamsters Union, and on the East Coast, they have 100% retention of every single group. They are a concierge white glove retirement company that puts the retiree first. And just like we had talked about with the call center, you always talk to the same person that you talked to before. The number is recognized. They work with all the Medicare companies, and we would definitely go to market looking at what would be available to you. But what we're really concerned with is that the retirees feel cared for, taken care of, and that they trust the health plans that they're in, and they understand how to use them. So you want to go back to pharmacy? Susie, I'll give Susie a couple more minutes on pharmacy.
Yeah, so pharmacy, just we want you to know that there is quite a bit of savings. Average savings range on our coalition is 10 to 30%. And on our clinical management pharmacy, it's 20 to 40%. So we do really put our pen to paper for our members and for our school districts, most importantly. We started out as a school district and as taking care of school districts, and that's really what we specialize in.
Perfect. Well, we appreciate the opportunity.
Gosh.
Now we'll entertain some questions and go from there.
That was the quickest finalist meeting.
Thank you, guys. Y'all all doing good
I am
today.
so sorry. I'm sorry we talked so fast. We were just trying to cram so much
Nope,
in.
that's completely understandable.
Yeah.
So you mentioned that this is the team, so
Yeah.
you three will be, I mean, we're not gonna call three people, so let's just maybe narrow it down.
Yeah,
and say
yeah,
who's gonna be the main contact?
Yeah, you're looking at them
Okay,
right here.
great, thank you. So if you don't mind, I'm sorry, where were you located again?
Me?
Yeah.
I'm on Jefferson Street downtown.
Great, thank you.
Yeah.
In your specific practice.
Yep.
How many self-funded accounts that you currently manage are with either Blue Cross, United Healthcare, United Medical Resources, Aetna, or Cigna, and how many of your self-funded accounts that you currently manage provide healthcare benefits to their employees that you have negotiated directly with healthcare providers?
Sure. Yeah. So, self-funded specifically to my book of business, I've got 20 self-funded clients with those three vendors. I do probably, I would say, through the years, several clients that we've negotiated directly with specific, even here locally, Lafayette Surgical Specialty Hospital back in the day when they weren't participating in network. That's one contract that we've had. Directly today, I've got a municipality in Baton Rouge where we have a direct program that they utilize with a direct negotiation. So I would say specifically to me, I've got 20 self-funded clients. I've got one that's currently active that we directly did, but through the years, I'd say a handful of others with direct negotiations as well. Now, obviously from a team perspective, Lori and Susie will tell you 400 over self-funded clients, and they kind of spread beyond Louisiana, right? I'm the Louisiana focus. They're spreading beyond, so.
So let's talk about the pay structure. If you were chosen to represent Lafayette Parish and you found yourself in a situation where any healthcare organization or insurance company provided you or your organization with any type of compensation whatsoever, whether it's commission, bonus, override, or any other type, will you immediately reduce the amount we owe you by 100% of that compensation that you would have received?
Yeah. So I can give you the Assured Partners legal answer, which is we'll do everything to the extent permitted by law. I think both the Gallagher representative and Lockton answered Louisiana has a very unique rebating law. I would say our consulting agreement obviously would be worked out and it's fully transparent. So, extent permitted to law, following everything, that's how we would respond to that.
I wanted to also comment that at the end of each year, we do what's called a stewardship report. That stewardship report gives you our compensation, and it also gives you all the number of hours we've worked for your account, the issues that we've tackled, and present that to you. So it's totally transparent. The other thing that we do, and we're willing to put on the table, is performance guarantees. So we're willing to offer a performance guarantee that puts 20% of our fees at risk if we do not perform to your standards. And there's two elements of that. One is response, and response and service, and then, completing the things that you've asked us to do. So I just wanted to mention that.
That's impressive. I guess the only question I would have about a performance guarantee is typically, in my experience, a performance guarantee is two-sided. And so, what we're looking for here is a consultant, someone who's, there's going to be no conflict. And so, I don't know what situation would ever put our consultant in a position where a company would pay them, because I can't describe what has happened in the past. It happened, but I know that brokers and agents and others who are agents of record, et cetera, would get paid a commission. But outside of what I'm aware of how an insurance company would pay you, I know it has happened. And so we're not asking for anything illegal to happen, clearly.
Right.
But there's no law that mandates that you receive a commission, so that we have to figure this out is what I'm saying, right? And so, two-sided. On the performance side, what's the other side of the performance guarantee? You mentioned that there's 20% at risk if you don't perform, but what if you overperform?
There's nothing on the other side. We're expected to overperform. I think that we all aim to do that. We also have with a lot of our clients, we require a performance guarantee from the carrier. And if those carriers don't perform for the client, then they put performance guarantees also on the table, and we monitor their performance. And if they're not performing for you, then you end up receiving money from the carrier for their performance. And it's very typical because we do have a lot of large clients that are in the 20, 30,000s, and it's the carriers need to be held accountable too, that they're giving you what you expect and that they're performing up to your standard.
Agreed. And then the last question, as you know, we're one of very few organizations where retirees remain on our health plan after retirement. Given that, do you have any real-life experience in creating ways to minimize risk from that population outside of a migration to Medicare Advantage?
So I do have experience moving and changing self-funded programs from an active population to a retiree population, modifying the benefits that are more favorable towards the retirees and things like that, but still keeping the standard self-funded program similar to what you guys have in place today with your retirees participating on the active plan, just different benefit structures. So done that with the municipality in regards to that, as well as in conjunction with the Medicare Advantage program. So I think it's leveraging all of the different aspects of what's available to you as an organization to put something in place that makes most sense for your retirees.
I had lots of thoughts about the performance guarantee, but it would make our meeting go a lot longer. I'm going to ask my same questions, and I think you've kind of answered a few of them just in your presentation, but I just wanted to highlight it because there are a lot of people watching this meeting, and it's hard to pick apart the parts that are important to our public. How many employees do you have working in Lafayette Parish currently with Assured Partners?
So Lafayette Parish, we have 40 employees, all located at our downtown location on Jefferson Street.
Okay. And I know you're partnering with Keenan, and it's great to hear that you started in school districts. Where is a call center located? You mentioned, sorry, I have a lot of notes. You mentioned
24/7 emergency line?
Yes,
Yeah.
the emergency line.
Yeah.
I think that's something that our retirees and employees, I like what you said about the being able to concentrate on teaching and then not be worrying about your benefits. So,
yeah, it's located in California, and we service about 100,000 enrollees on the call center. It's very robust, and like I said, there's a call center plus a helpline plus the 24/7 emergency line.
okay, thank you. And you mentioned a little bit of it, but how would you incentivize our members to come be educated about these changes, proposed changes, and their benefits? I think you talked a lot about it, but just highlight that again for me, please.
Well, I'm kind of old-fashioned. I love to do things in person. I love to do in-person things. I think just getting to know each person's individual story and getting to know them just makes you able to do more for them and help them in ways that you might not expect. So when I've done moved retirees quite a bit, moving different municipalities or school districts to different benefit plans, I've definitely done in-person meetings, but then we film them. We actually put them on YouTube. Don't look me up on YouTube. On YouTube, so retirees from all over, where if they couldn't come, maybe they don't have health, or they've moved out of state, they can click and listen online. We also have extensive benefit administration systems that allow those people that are tech savvy to go online and enroll on their benefits, look up their benefits. They can see, what benefits do I have? They can go to the dentist and say, here's my dental benefit, on my phone, those types of things. But we would start with in-person. We obviously know that, like they had talked about, sometimes it's a postcard. Let me give you a little bit of a hint, though. Whenever we do a mailer to retirees, we always mail them in your envelopes. And we mail them in your envelopes because they're like, who's Assured Partners? I'm going to throw this in the trash, right? But they're going to recognize the school system, right? And this is where, oh, this is important. I'm going to open this. So we use those types of strategies so they recognize what's coming to them, and they open it, and they definitely read it. So that's something that's been really successful for us.
And we're here really late at night. I know City of Orange, we stayed till like 9 or 10 o'clock at night. Orange Unified for the bus drivers to come in, to make sure that we're covering everybody and that everybody's been able to hear from us and talk to us. It's important everybody's heard from.
Thank you. That's all my questions.
Thank you.
Hey, and what other school systems in Louisiana do y'all have experience with?
Well, I'm going to go ahead and say in 1991, our former Landry Harris was the consultant for Lafayette Parish School System, but no, currently, no. I do not work with any school systems in the state. Other municipalities, but not school systems.
All right, thank you all very much.
All right.
Thank you.
Thank you.
All right. Next, we'll ask Acuity to come up to the table and get prepared. Actually, thank you, Ms. Mason. We're going to take a short recess. I would say, is 5 minutes long enough? We'll take a 5-minute restroom break.
We've been sitting for an hour and a half.
Okay, no, you're welcome.
Take a break.
She went to the restroom. Yeah.
All right, we're going to call the meeting back to order. If we could take our seats and ask Acuity to come up to the table for their presentation.
Do I have to do something with this? Do I have to do
No.
something? Okay.
All right, sir. The floor is yours.
Thank you. Is this good? Volume good? Okay, thanks. So I think this morning, the one thing I figured out pretty early on is that in the herd of zebras, I think I'm the one with the spots. I have friends in the audience and competitors, and we don't really do the same thing. And so what I want to be clear about this morning is, first off, my name is Kelly Cox, and I live here in Lafayette. My office is about 2 miles down the road. So I want to be clear in that what the differences and the distinctions here, in that in my 35 years in the business, of which about almost 25 of them are in the TPA business. I think we've heard the term TPA thrown around here a lot this morning, Everybody knows what a TPA is and does, I assume. Is that correct?
Can you just explain for everyone at home?
Yeah, thank you. So in the TPA business, we are hired. So I consider myself to be an independent agent who's in the TPA business. So typically, independent agents come to us to manage their self-insured plan. We actually pay the claims and administer the plan. So maybe an analogy is that we kind of act like Blue Cross, but it's your money. So my charge in the process, it's clear. It's to protect plan assets. That is my job, okay? So you hire me to protect your plan assets, and if I don't do it, then you find somebody else to do it. And so as an independent broker and an independent TPA, I believe that the direction that you have been in and the boat that you are in is not the right one for you. And I may be the only one this morning that's going to say that. As the guy who owns the Patriots once said, I believed in it so much I bought the company. That's me. So I deal with the big insurance companies of the world every day. Typically, they're on smaller groups where there's not as much competition and not as many alternatives. And that's unfortunate. When I first started in the business, we had probably 12 carriers that I could go to for my buddies that have a 10-employee company. Unfortunately, we're down to 2, and they're the 2 that you've heard of a lot here this morning, one of which you are currently with. So I come to you this morning knowing how they operate, knowing the pluses and the minuses, and I, again, reiterate to you that I believe that there's a better mousetrap for you. I do believe it's in the independent TPA space, and to be clear, and I'll get into this in a minute, I would not recommend that you use my company. I am here today as a true consultant, a true independent consultant. And so what you're getting with me is you're getting somebody who, as an independent agent and a TPA owner for over 25 years, I have competed against and work with vendors that I will bring to the table for you. So they have been vetted. They've been vetted by me, either as working for me or me competing against them, okay? So anyway, with that being said, and I welcome any questions about that, because I believe that that is a critical piece here, and that I think that, I'll just say again, the answers that you hear most often are not always they're certainly not the only answers, and they're not always the best answers. So anyway, with that being said, completely different perspective that I bring to the table here. So a little bit about myself. So in our third-party administration firm, we have business all over the country, and we have brokers, as I said, that bring us business, and they're all across the spectrum, or the continuum, if you will, on plans and how plans are set up and how they're run. We have typical PPO plans, and on one end of the spectrum, and then you move across, we've got reference-based pricing plans where I negotiate and vendors together negotiate with providers all across the country, including here, to get the best pricing possible. And so, anyway, lost my train of thought here, but, so on the spectrum, we manage and adjudicate claims for all different plans. Everything that you see up to the cutting edge, reference-based pricing, direct primary care. We do all of this, and we do it every day, all day long. So I believe, as somebody mentioned earlier, that some of those more cutting edge options are for you. I do not. But I will say this, that in my 35 years of self-funding, it should never occur that a benefit plan should change to the detriment of the member. It shouldn't happen. Did everybody hear what I just said? Does that make sense? Because in a self-funded plan, if it's run efficiently and properly, if anything, the plan should get better, right? I put in my RFP, and I think this is important and critical, that one of the oldest accounts we have is in Winsboro, Louisiana, and it's 12 employees. They've been with us for over 25 years. Their benefit plan has never changed, never. They have a $250 deductible. Their co-insurance is $90/70, and their out-of-pocket is $1,000. They have no drug card. No drug card. No copays, no drug card. So that is an example of how a plan runs efficiently. How does that happen? Well, we can get into it, and I was joking with Trish. I asked her if she had my presentation ready, and she laughed. I'll tell you that in my 35 years, I have never sold myself or anything in 15 minutes, and I don't think today is going to be an exception. But what you are getting is me, and you are getting my knowledge of the industry and the vendors that I know that I bring to the table that can do this because I've seen it. They've done it with me. So one of those vendors I've really already selected is going to help with the Medicare population. And I met these folks back about 10 years ago and have watched them closely because I know more than enough to be dangerous, but that's why I go to them, because they are going to hold the hand of the Medicare participants. And we'll talk more about that in a minute. With no presentation, I'm already got 6 minutes left, so I guess I'm doing all right. But so I think the biggest issues when I look at your plan, and really I want to be clear on this because you're going to ask me a question of how many school systems do we have, and that answer is 0. There is no unique difference in the school system that's any different than any private entity with regard to self-funded plans. The issues are really 2, and they're the same 2 issues with every self-funded plan. And the question is, how are you going to manage those 2? And one is large claims, and 2 is costly prescription drugs. How are you going to manage them? Because that is what takes your plan down. The nickel and dime claims of professional visits, doctor's office visits, that's not going to be an issue. Shouldn't be an issue, which goes back to the question of why should benefit plans change to the detriment of the member when it's not an issue, okay? Now, there are some aspects of the benefit plan, particular, and I'll talk about one, for instance, how the pharmacy benefit is designed, that is a critical piece, right? Because that leads to one of the 2 drivers that I told you about. So how that is handled and how that is designed is critical. And I believe that initially I wouldn't make any change to the benefit plans really other than that, okay? Because I believe that specifically has to be addressed. And it has to be addressed such that the members are educated on a one-on-one basis as to what they've been prescribed and what alternatives they have that are either identical or very similar that will save them money and the plan money. And they have to be educated in that regard, right? That's not something that they're going to know. Some vendors, PBMs, have apps that help, kind of transparency and stuff. That's all great. But so anyway, I think from there, I guess one of my, and I'll get back to the big issues here. But one of the things that concerns me the most at this point is that if we're going to move in the direction that I am putting before you, the timing is a problem. I'm looking at you. I'm sorry. I'm looking at you, Trish, because I know that this is something that you deal with on a day-to-day basis, but I know that you have been handling open enrollment from mid-September to mid-November, correct? And I think that the reality of how this is going to go down, if you go in my direction, is that the decision's made at, I don't know, sometime between now and the end of the month. So August 1, the consultant's going to start. And I'll tell you that what you haven't heard, but I think everybody knows, and they've mentioned, I think, in the questions, is that we're going to need a significant data dump that did not accompany the original submission, right? And that's for a lot of reasons, to get reinsurance and to be able to analyze the plan. But so starting August 1, we're going to need a data dump that's going to be significant. It's not going to get here in a day or two, okay? But the incumbent carrier and the PBMs will probably get us the information, if we're lucky, within 2 weeks, right? That's just the reality. Again, I deal with this every day, so I know. I'm kind of, I guess you'd say, behind the curtain. I'm where the sausage is made. So a lot of the ideas and things that you hear and see, I was telling Mr. Campisi that we have to actually put those in place. So I know as an administrator what actually happens there. So in order to get that information, to go out and shop reinsurance, make any necessary changes, and then get a bin admin system that is going to be adequate and up to the task, that is a huge task. And I think you all said in the RFQ, whoever is selected has got an uphill battle, and that is the biggest understatement, I think, of the year, unless you stayed where you currently are and want to get the same results that you've currently been getting, right? So anyway, cutting through my time pretty quick. Retirees. I talked about retirees because I know these are questions that you're going to ask. And first off, let me tell you real quickly here that we are not going to force retirees to do anything, okay? But we're going to take the existing system and we're going to make Medicare and the supplements effective, and we're going to leverage Medicare so that the feds pay more and we pay less, okay? And in that process, what we will do is we will educate. This vendor will do nothing but specifically educate and service the Medicare population here at LPSS. That's their entire role, right? So I think with education, as others you have said, you have heard, I think we can get from 10% participation in Med Advantage, I think we can get that up to 40 or 50%. There are adequate products out there, I know, because I've heard that a lot of folks are scared. They don't understand, and they think that Medicare Advantage is a scam. And I'll tell you, I understand. I understand where you're coming from on that. So anyway, last point is we need to cut down on leakage from Medicare into the private self-insurance plan. That's a problem. And I think the number was 2.6. I believe it's probably much more significant than that. With that being said, I think I'm pretty much out of time.
Thank you, sir. We'll, if it's okay, go right into the questions that I have prepared. Mr. Cox, I have to assume that you are the individual person who would work with the superintendent and his staff on a monthly, weekly, or daily basis should you be awarded the contract.
That is correct. So I am the point person. I am the consultant that you hire. I'm the one that deals with you on a daily basis and a monthly basis, and I am the one that monitors the vendors that I bring to the table. And what will happen is with those vendors, especially with the TPA, again, that will not be my company. That would not be in a true independent consultant role. I would not be using my company, and I won't. But you will have account executives, and they will be executives from these companies that will be helping me and assisting me on a day-to-day basis, right? So I will be the point person, and Sam Molnar from Health Insurance Services will be right there with me because, again, he will be full-time dealing with the Medicare population. So, but all that flows through me. I'm the guy. So I'm the one that will be here at meetings. I will be the one that Trish calls if she has any problems. I will try and want, because the whole idea here, Jeremy, is to have the vendors, if they're doing their job, then it takes a lot of work off of Trish in their office. I know your job is to keep people happy, and you do an excellent job of doing that. But the reality is if these vendors are operating the way they should, service calls should go to them, and that reduces your workload and your staff's workload load tremendously.
Okay, so you'll be the point of contact, and I think you, I know you mentioned you're in Lafayette down the road. Question number 3, two-part question. In your specific practice, how many of your self-funded accounts that you manage or currently manage are with either Blue Cross, United Healthcare, United Medical Resources, Aetna, or Cigna? And the second part of that is, how many of your self-funded accounts that you currently manage provide health care benefits to their employees that you directly negotiated with healthcare providers?
Okay, I think I understand the question. The first part of it is clear. I don't have any business with any of the self-funded business with any of the large insurance companies. I want to be clear on that I have had in the past, and even as I was a TPA owner. So I have worked with 2 of the companies that are mentioned the most. I've had self-insured accounts with them while I was a TPA owner. Now, that might be a head scratcher, but I do believe that an independent broker mindset is, I do what's best for the client. I don't do what's best for me. So that's number 1. Number 2 is, as I mentioned earlier, because of the nature of what we do, because I basically consult on every account we have. So the answer is yes. On more than half of the accounts, I have talked to providers, not just here in Lafayette, but all across the country, to try to, I believe I understand how that, I don't believe, I'm certain that I understand how that process works with networks. It is not, especially big, broad networks, or I'll just say typically not in the client's best interest. But I mean, narrow networks and direct contracting is the answer here. And just one more piece of that. That is what I want to bring to the table, is to engage our local community in a dynamic where they are working with LPSS and the taxpayer to get the most out of this plan and bring the most to the table for the members of LPSS. And as somebody mentioned before, the big contracts from the big insurance companies get in the way of that. It doesn't allow that to happen, right? You can't have a direct contract aside from one of the BUCA's big networks. They're just not going to allow it. So, I'm sorry, long-winded answer. I said, I'm sorry, that's me. I talk too much.
So I think I understood you to say that you do have clients that you represent, accounts that you represent, that you currently manage, that you have negotiated health care benefits directly with healthcare providers on behalf of said client.
That is correct. And again, just to reiterate, no current accounts with any of, we call them the BUCAs. That's the big insurance companies that you've heard about. We don't manage any self-insured accounts currently with them.
Okay. If chosen to represent Lafayette Parish, and you find yourself in a situation where any healthcare organization or insurance company provides you with any type of compensation whatsoever, commission, bonus, override, whatever it may be called these days, will you immediately, in the legal way, submit that money over to 100% of said compensation over to Lafayette Parish School System?
Okay, good question. Let me say that in the true essence of a consultant, that would not happen with me. It's not going to happen, okay? And I will stipulate in the contract that I will receive no remuneration other than what my consultant fee is. Now, the vendors that I bring to the table will be basically billing LPSS, right? That's, I mean, we're putting the plan together. They're working for LPSS, and so LPSS will be paying their cost. The vendor that I have chosen, for the Medicare population works in one of two ways. They either receive commission from carriers, or, as you've heard earlier this morning, they can bill LPSS on a PEPM, and any commission they get, they offset that fee. Does that make sense? You've heard similar stories about this, but but to be crystal clear, the fee that I outlined in my packet is my fee, and that's it. And the contract will be absolutely clear on that.
Last question is regarding the retiree population, and you touched on it a little bit, but as you already know, we're one of the few organizations where retirees remain on our health plan after retirement. Mm-hmm. Given that, do you have any real-life experience in creating ways to minimize risk from that population outside of a migration to Medicare Advantage?
Again, I personally do not, but that is why I go to experts that do. And so I talked about some of the things that, a couple of the big points that we need to address. And this particular provider, Health Insurance Services, has, I think he said, almost 500,000 members that they manage. So, and most of them are municipalities and school systems. So anyway, these people know what they're doing, and that's why they're here. I should say at the table with me, right? So again, me specifically, no, but I know people that do and do it for a living.
Thank you. Ms. Mason.
All right. Mr. Cox, I know you're here by yourself today, but how many employees do you have here in Lafayette Parish?
So in our Lafayette office, we have 4, okay? And I want to be clear on this, Hannah, that although those are 4, they work for me and my company. They will not be doing work for LPSS, okay? So again, I am the person who will be the consultant, and me and my team of vendors will be the ones who will be servicing the account. So I've heard about call centers and all that. I know that Health Insurance Services has a call center that they will use to enroll Medicare Advantage people on a one-on-one basis. And so that is only call center that will happen on, you know, other than you calling or members calling into the vendors to have questions answered. I don't know if that makes sense, but
okay.
Yeah.
Thank you. Okay, so I won't ask the next few questions. What are your thoughts, and I'm changing my last question for you. What are your thoughts on better educating all of, our 10,000 people on our plan?
That is a huge point. And so I think that if I'm being frank here, I would tell you that it is a much bigger problem on the Medicare eligible side than it is on the private plan side. I think that you've been with the carrier for so long, the benefit plan has been relatively stable. I know there's a recent increase in the plan, but so I think by and large the actives and the members on the active plan pretty much know how the plan works, right? So I think that education is always key, but I'll tell you this is one of the things that I run up against often, is that we can talk about, for instance, PBMs and prescriptions and instructional meetings, and what will happen is if, let's just take hypothetically a young male who's healthy, they'll be at the meeting and they'll be listening, but if they're not taking a medication, it's going in one, out the other. And then 6 months later, when they get prescribed something, they're like, what did I have to do again? So it has to be constant and ongoing, and it has to be targeted. And so I'm a huge believer in that, and especially if we're talking about, if we're talking about changing to an independent TPA, if we're talking about going to a narrow network or use direct contracts locally, then there's going to absolutely have to be education, and that's part of it. It's what we do every day. Sorry for the long-winded answer.
Thank you.
Mm-hmm.
No, sir, he answered both of mine in the presentation. Thank you, appreciate it.
Sure.
All right, thank you very much.
Thank you.
All right, moving along. Nothing moving. Up next, Brown and Brown. If you would please come to the table, get prepared. You're welcome to bring extra chairs up. We just ask that anyone who speaks, just hand them the mic.
Okay, fantastic. Thank you.
Just gonna make sure I can move properly. All right. Ready? Let's go. Thank you. Good morning. I'm Jennifer Clements, and our team represents Brown & Brown. We would like to thank you for inviting Brown & Brown to participate in the finalist meeting. Our intention today is for your team to get an insight into Brown & Brown by asking questions, as well as walk away with some details of our proposed solutions. We understand the significance of the decision your team has to make, and we want you to feel comfortable and confident in that final election. Our differentiator that we are proposing is a co-consultant approach led by Jason Huffman and myself. Both Jason and I are fully responsible for your benefit program. We feel that this is not only beneficial to Lafayette Parish School System, but also a value add to your employees, their families, and retirees. Jason and I bring unique skill sets and strengths that will only further complement what your HR and benefit department is currently providing. I've been in the industry for 25 years, working alongside self-funded mid-market clients. My main focus is advocacy. I will bring every tool and resource available to effectively manage your benefit program. With that, I would like to introduce Jason Huffman, co-consultant.
Thanks, Jennifer. So yes, my name is Jason Huffman. I bring 25 years of professional experience to the team, and several of those years were actually as an educator myself. So the mission of Lafayette Parish School System is near and dear to my heart. My professional training and background is in mathematics, statistics, and actuarial analysis. So I bring that to the team as well. I feel like the talents and backgrounds that Jennifer and I have complement each other well.
Next, I would like to introduce Mark Romero, our Gulf States practice leader.
Thank you, Jennifer, and we would like to also thank you for having us here today. We look forward to having some good discussion about how we can bring value to you. My responsibility with the company is really to lead our Gulf States operations. I've had the privilege of working with all of the people here with you today, and am honored to bring what I think to be a very talented team that covers a lot of different bases in supporting your needs based on the evaluations we've completed. Our company is a little bit different from the other brokers here. We are decentralized. We're a national public broker with local commitment, and basically we empower leaders at the local level to make decisions. I don't go through a hierarchy of decision-making processes. Typically our team identifies our needs, whether it be technology, talent, resources, and we commit to those decisions together and bring those solutions to you in a more deliverable and expedited fashion. I believe that the ultimate opportunity here is to focus on those pain points you have. I know that our team has done a pretty good assessment. There's a lot more to come, obviously, with the additional information that comes with once you make a selection. And I know fully that we can fill those obligations and meet your expectations. Thank you.
Thank you, Mark. Next, I would like to introduce Stacy Bienvenue, our operations manager.
Hi, I'm Stacy Bienvenue, and I have 35 plus years in the insurance industry and handling self-funded plans. I will be heading your service team and will be involved in the day-to-day operations. We are located just around the block, so if anybody needs anyone to deploy here for, something immediate that happens, we're actually just in walking distance. Not on a hot day like this, but we are in walking distance.
Thank you, Stacy. So the tagline that you're going to see displayed and discussed throughout our presentation is think different, get different results. Over the next 12 minutes, we're going to explain when you think differently, you can achieve different results. We're able to think differently because we have subject matter experts across the country in 500 offices and over 15,000 teammates. We have national strength with local partnerships. We can and will utilize a think tank method as well as those subject matter experts in every discipline to provide different results. Within our written response, we have provided client testimonies that speaks to the relationship and the goals achieved through a partnership with Brown & Brown. Embedded within this oral presentation, we have an additional client testimony. Trust, transparency, and accountability are our core components that we build in every relationship and that we would like to establish with Lafayette Parish School System. As we move forward in our discussion through a few proposed solutions, you are going to see how we can help you manage costs, control costs, manage risk, and improve employee experiences. With that, I'm going to hand it over to Jason Huffman.
Thank you, Jennifer. So what we'd like to do in the next few minutes is just to dig in on a couple of the strategies that we feel would be most impactful for the partnership with Lafayette Parish School System. We're having a little technical trouble here.
Slides won't progress forward. Computer's tired.
Pause the
Perfect,
time,
thank you.
please.
Thank you.
So what was I saying? Strategies that would be most impactful for Lafayette Parish School System. And the first of these is what we call risk pool management. The challenges that you all are facing in managing your healthcare program are not unique. Employers across the country are facing the challenge of rising healthcare costs. And sometimes it can feel like the strategies and suggestions that come to you from the marketplace are like being on a hamster wheel. You're running, but you're not getting anywhere different. Well, Brown & Brown, I'm proud to say, has a unique, innovative solution that is getting different results for our clients. So in the few short minutes that we have here today, we want to talk about how those clients are achieving those results, how they're managing their costs differently, and how they're doing it at the same time as offering benefits that are often more rich and more strong than they were before. So how does this work? Well, we think of it in terms of the analogy of building a house. First, you have to set a foundation, then you have to build a structure, and then you furnish that house with everything that you need to make it sustainable and livable. What a lot of our peers, others in the marketplace, are talking about are options that attend to those second two steps there, the delivery of care and chronic conditions in this example. What makes Brown & Brown different is that we attend not only to those two, but we also focus on the very first step, the foundation, which we call risk pool management. So what is your risk pool? Well, those are all the individuals, it's the people. It's those employees and retirees and their dependents that make a choice to opt into your health benefits plan. And what we've found with our partners is that if we're more strategic, more intentional about paying attention to that risk pool, we get different results. It all comes down to how are we inviting employees to participate in the benefits plan, and what does that choice look like? Now, we all know that large claims are driving cost, right? That's not unique to Lafayette Parish School System. In fact, a society of actuaries that tracks data on millions, tens of millions of lives across the country tells us that roughly 10% of the people drive 90% of the cost. So what does that mean? On the flip side, that then 90% of the people are only driving 10% of the cost. So why is that important? Well, it's important because everyone has a choice to make when it comes to participating in the plan. We call this the value proposition in healthcare. It's the bottom right-hand part of this slide. Everybody is going to make a choice. Those employees, once a year at open enrollment, are going to decide, is what I'm getting worth the value that I'm spending, what's coming out of my paycheck? And our data tells us that those two populations, the 10% and the 90%, are going to look at that value proposition very differently. Just very quickly, let's compare John, a 45-year-old who's also a hemophiliac. We know he's going to have large claims over the course of the year. He's going to look at this value proposition probably with not so much the deductible in mind, but how much is coming out of his check, plus the maximum out of pocket being a key factor. Okay, compare that to Jed. He's a 29-year-old who rarely goes to the doctor, maybe once a year if he's got flu symptoms. Okay, he's going to look at this value proposition very differently. Okay, maybe deductible isn't the most important, but you know what is going to be most important is how much is coming out of his paycheck. Right? So again, who are we inviting to participate in the health plan, and how are we inviting them? Very, very important. We can't go into all the details because of time, but suffice it to say that risk pool management, in that process, we track 47 different metrics. 47 different metrics that help us to right-size that choice for your population. We can custom design the value proposition that you present to your employees and your retirees. And better choices there, better design there, can invite more of the good risk, more of that healthy risk into your risk pool. And this includes, of course, the 65 and up population. We've talked a little bit about how important it is to make sure that their choice is heard and attended to. We have a whole division at Brown & Brown that's devoted to serving that population. So a good question is, does this method work? Okay? Does this method work? Well, what you're going to see on the following slide is actual data from 37 actual Brown & Brown clients, those who are implementing risk pool management strategies. And I need to point out that along with those strategies, one of the things they're doing is they're making their health plan better. A lot of those groups have deductibles of about $500 to $750. They have $20 copays at primary care physicians. A lot of them have $0 or $5 copays on generic prescription drugs. So the offer, the value proposition that's presented to staff is showing a lot of value. Okay? Many of them are seeing 10% or more decrease in costs in the second year. Here's an example of an employer who had a $6,000 deductible, dropped it down to $800, and they were able to save 24%. Here's another Brown & Brown client, about 8,000 employees. By the third year of implementing risk pool management strategies, they saved more than $11 million. So risk pool management does work. We are helping our clients to think differently, and we're helping them to get different results.
As mentioned, this is an embedded testimony from a client. We will not play it at this time. You can listen to it at your leisure. Our next key differentiator is Brown & Brown's Managed Pharmacy Alliance practice. Excuse me. Lafayette Parish School Board's second highest spend is contained within your pharmacy plan. The proposed budget for 2024 and 25 is just shy of $29 million. We have all experienced the rise in pharmacy costs as well as new drug trends emerging. So we know that the pharmacy industry is ever evolving. That's why we feel it's imperative for you to partner with a team that also will evolve as needs arise. Our team of expertise is comprised of, it's very sensitive, industry-leading experts, enhanced analytic capabilities, as well as pharmacy alliance contracts. Some of those pharmacy alliance contracts are with national PBMs, as well as the top 3 PBMs, such as Express Scripts, CVS, Carelon, and Right Way, to name a few on our panel. Whether it is through carved-in or carved-out options, traditional or pass-through pricing, or enhanced pharmacy consulting, our team can address every need for every client, regardless of industry or size. As I mentioned, it's imperative to have a partner with best-in-class pharmacy solutions. Some of those Brown & Brown key components include clinical oversight and insight derived from specific plan utilization. Pharmacy plan design recommendations driven from our analytics. An annual pricing validation model will be provided to Lafayette Parish School System with a few key benefits of an analysis report to show how your plan performed based upon contractual terms and language. Our team will ensure that guarantees within your contract are not only realized, but adhered to by your pharmacy benefit manager. We will also review the overall plan performance and make necessary changes and recommendations throughout the plan year as needed. Brown & Brown's Managed Pharmacy Alliance team is a 360-degree platform with various arms, all focused on the lowest net cost. At the onset of a partnership, Brown & Brown is able to deploy our alliance contracts with your current PBMs. That's an initial strategic solution. What that allows for is consistency of the current pharmacy plan, the least amount of disruption for plan members, as well as generate savings utilizing our contracted terms, language, and pricing. Within our written proposal, we provided several recommendations too, which have deployed this specific strategy and have achieved significant savings, and we share that within our testimonies. In addition, we have an array of solutions to offer at various stages of our multi-year strategy. So again, what is important? It's important for you to partner with a provider that can provide different strategies and generate different outcomes.
One of the things that's also so important, and a couple others have touched on this today, is the ability to dig in deeply on the data. Brown & Brown has our own proprietary software. We call it the Health Plan Intelligence Tool that Lafayette Parish School System would have access to this through your consultants. So that gives us a deep, deep look at everything that's going on inside the plan and where we can help to advise you in a more efficient fashion. So what, just kind of wrapping up here, as we're having trouble with the technology again, wrapping up what I hope we've been able to convey in these few short minutes is that Brown & Brown is different. We're a different kind of firm. We have national strengths, but we have local partnerships that we activate effectively, okay? We are bold, we are different, and we challenge the industry norms. And we're confident that this strategy of risk pool management could be exactly what Lafayette Parish School System needs at this time. So we thank you so much for the opportunity to come present here today. We would love to be able to help you think differently and get different results.
Thank you.
Thank you all very much.
Thank you.
Thank you.
All right, let's go through the questions. So number one, Mr. Huffman, and Ms. Clements, if I understand correctly, you two will be the individuals who will communicate and work with the superintendent and his staff on a monthly, weekly, daily basis, should that be necessary. Great. And
Yes,
you
sir.
are both in Lafayette, I know?
That is correct, yeah.
So Jason is in Lafayette. I'm actually in the Covington-Mandeville area. But we thought, knowing that it would be a great need to have someone local, Jason will take the lead at any point that you need someone here, say that afternoon.
Okay, sure. In your specific practices, each of you, how many of your self-funded accounts that you currently manage are with either Blue Cross, United Healthcare, United Medical Resources, Aetna, Cigna, or any of the big ones? And the second part of that is, how many of your self-funded accounts that you currently manage provide healthcare benefits that you have taken part in directly negotiating with healthcare providers?
Mm-hmm. You want to go first?
Yeah. So most of the self-funded clients that we help to manage are with the big TPAs, the big carrier TPAs. There are no fewer than 3 that we've helped to negotiate benefits directly. Okay, negotiate benefits directly from our team. And we do have one self-funded client that is not with the big major ones. It's with a TPA out of Dallas.
And just to add to Jason's response, our team here 100% negotiates placement of coverage for our clients. We don't outsource it. It's not being managed by an office separate and apart from us. We do that 100% collectively.
I'm sorry, can you repeat that?
Yes, to add to Jason's response, our team here in Lafayette manages 100% of the negotiation and placement of the clients that we support through our Gulf States operation. We do not outsource it. We do not have an office in another state engaged in that placement effort. We do have resources from other locations throughout our company, but we actually place 100%, negotiate and place all of our clients here.
Just a quick add-on to that is we're TPA agnostic. Yes. I mean, we're going to do what's best for Lafayette Parish School System. Mm-hmm. And to have those partnerships and relationships across the big TPAs, in addition to others in the industry, we feel is a tremendous asset.
Right. And And one additional point too, at the beginning of our presentation, we showed you a map of Brown and Brown office locations and teammates. And we specifically mentioned that we tap into that expertise. So we don't only have the think tank model here in Lafayette and through the Gulf States offices, but we're able to capitalize on a larger think tank model to know what the best solutions, partnerships that we can bring to the table for your organization.
And if I could just very briefly sidebar here just a little bit. I'm asking that question, and many people may not know why. A lot of folks think that Lafayette Parish School System members have Blue Cross Blue Shield insurance, and they don't. Blue Cross Blue Shield is our third-party administrator, TPA. I don't think it's fair for me to ask any one of you or any other company to explain the difference because, you know, I don't want to get into that negotiation now. But I think that without everyone understanding what I just said, that's why I'm asking that question. This is not a knock on Blue Cross or any other large company. However, we don't have Blue Cross insurance. We have Lafayette Parish School System insurance, and Blue Cross is our TPA.
Right.
So anyway, that was my sidebar. If you are chosen to represent Lafayette Parish and you find yourself in a situation where any healthcare organization or insurance company provides you with any type of compensation whatsoever, whether it's commission, bonus, override, or anything else, will you immediately, in the most legal fashion, turn 100% of said compensation over to Lafayette Parish School System?
I'll give the simplest answer, yes.
Jesus. Number 5. As you know, we are one of the few organizations where retirees remain on our existing plan after retirement. Given that, do you have any real-life experience in creating ways to minimize risk from that particular population outside of Medicare Advantage migration?
Well, one of the beautiful things about the risk pool management strategy is that it's all about choice. It's all about member choice, employees' choice, retirees' choice. It's getting in on that value proposition, how they're deciding between what options they have to you, options that are presented from the school system itself, and then options that are available even on the individual market. The more that members are empowered with information and tools and resources that help them make that decision, the more they're able to understand what else is available. That's what we found to be the most powerful differentiator. Okay, and as I mentioned before, we've got a whole team at Brown & Brown that's expert at having that conversation.
Yes, and I can add to that because I actually do help with a local school board, and I work with the retirees, and they're dear to my heart because, of course, with change, comes a lot of emotional for them, and so I work one-on-one with them. And with this school board and the other ones that we handle, we had looked to our legal team to see about mandating retirees into the Medicare Advantage plan. And, we were told that that's not something you can mandate to do. You can encourage them, but you're supposed to give them the same type of elective ability that you give active employees. So we have vetted that. And we can do that again, but our school systems, it worked out in their favor. Most of them moved to the Medicare Advantage, so we never had to visit that again. But 4 years ago, we did, and that's not something you could do at the time. Things change. It could have changed by then. But what we also realized on that one is to engage the retirees. We'll do a retiree committee. So when you get the retirees involved and you get them that want to be active into getting to their community, it just helped a whole lot whenever we had convinced them that these were the right things to do. And I guess the question I get asked the most is, what would you let your parents do? And so that's very dear to my heart because, right now I do have my dad's in the hospital on Medicare and a traditional Medicare. I would never recommend him on an individual basis to be on a Medicare Advantage, but on the group basis, it's different. It's a whole different type of plan. And one thing that I wish they did is I wish they wouldn't have named it Medicare Advantage because I think we would have a lot less, emotional resistance from these retirees. That's what they hear from their neighbors and their cousins and everything else. So that if I could change anything, I would change the name of it to some type of group Medicare traditional plan. So
not only that, if by some grace Blue Cross bought out Humana tomorrow and the same plan were offered, we would not be having this conversation.
Correct, yes, correct. And that's, one of the other ones spoke about is Blue Cross Blue Shield, is the names too that come with it. And when you have Blue Cross Blue Shield, it's a trusted name, United Healthcare, it's a lot trusted. And one of the other things too that, that helped us when we're trying to communicate to the retirees is you put it in the newspaper. They all still read the newspaper. So that's one of the things that we're trying to do, any announcements, we do go to the local newspaper and do communications there.
And I know I'm getting a little ahead of Ms. Mason's question, but something that Stacy mentioned in regards to involving retirees, we feel it's very important to hear directly from them. Just like in a partnership with Lafayette Parish School System, our team wants to hear directly from you. We want to understand what works, what you've tried in the past, what resonates with your employees, their families, and their retirees. So we want to hear directly from retirees before any proposed solutions are brought to the table, because we want to address their needs as well. That's a very important measure. And then also in regards to communication, within our written proposal, we speak to an entire communication practice located at Lafayette. So we can assemble an entire host of different deliverables, formats to be able to speak to every age group, every population. And that's all customizable based upon our discussions and interactions with your team.
Thank you. I know you've touched on several of my questions, but I'm just highlighting them for everyone listening. How many employees do you have working in Lafayette Parish?
We have 42.
Thank you. And where is your call center? Or the people that our people will be talking to?
So one key element that we pride ourselves on, number one, in our presentation, we made a commitment that we will never have more than 20 partnerships. And that's speaking to Jason and I, because we want to become intimately involved with Lafayette Parish School System, your employees, their families, and their retirees. My background is service, so that's embedded into me. That's why I focus on advocacy. So we will have a team of account executives and client managers, and that's where Stacy's role comes into place to make sure we allocate proper resources so that way your employees and the plan members can build relationships with local individuals. So our call center truly will be a built-out client service platform for you here locally. Now, if a need ever arises to where we have to expand that call center, we do have an entire EB Tech team within New York where we can build a call center as well.
But just to clarify that point, we're located in Park Tower, so we're right around the corner. Those calls will be directed to a 337 number across the street, and then Jennifer and myself are available by our cell phones. You can see that right on the back of your handout.
Thank you. And then also, I know I'm kind of tailoring my last question. I noted, concerned with the risk pool management, and thought that was wise, but how would you incentivize our members? I feel like the risk pool management is much more on the LPS.
Oh, it's both.
Side.
It's absolutely
Side.
both.
So
Yeah.
help highlight how.
So
you
maybe
do that for our members.
the best way to illustrate this is an actual success story we have with another public school district that we manage in the state of Louisiana. They did not even have a group waiver plan in place. All of their retirees were on their main plan until this success story happened just a few years ago. So my colleague David, who's the primary consultant on that group, he led a team to kind of gather ways to build consensus within the group. It's really what Stacy was touching on a moment ago. Who are the retirees that know the plan best? Who are the ones who are going to be able to speak to the concerns that we're hearing in and out from our retiree community? So they established an advisory committee that then met with the superintendent, met with the key staff members that were a part of that process, met with our colleague, and guided that whole process forward through open communication throughout. What are the concerns? What's most important? How do we make this decision best? Put the group waiver plan in place. And even in that first year, there was a high percentage of folks who made the choice. Again, it's all about choice first, employee choice, retiree choice first. It was over 80% in the first year, and then once word of mouth spread to what the success was in terms of accessing those benefits, it's now over 95%. okay, 95%. And as you well know, it's kind of what we touched on in one of our slides. Small changes can sometimes have a big effect. We have another client that has had a similar story. This was not a school district, but in the first year, only 8 members transferred over to their group waiver plan. It resulted in a $500,000 reduction in claims the next year. 2 years later, more than 40 had made that changeover, and then it was a 1.5 million reduction in claims costs. So again, it's all about that communication. It's all about presenting the choice first.
Okay, thank you. Yes, our superintendent has created an insurance advisory committee, and but it's a new change since he's come on board as our superintendent. So hopefully we see that success.
Great
as
idea.
well.
Yeah, I want to thank y'all for being so informative. You answered my question on retirees. Like, have y'all worked with any of the school systems kind of the size of Lafayette Parish?
We do, yeah. In fact, we work with 2 other school districts in the state of Louisiana currently as their primary consultants.
Is that St. Martin Parish in Lincoln?
That's correct, yeah.
That's correct. Thank you.
Mhm.
You work in a broker capacity with them or consultant capacity?
So I guess I would describe that as both. Okay, we're consultants first, but we also broker the coverages, we broker the services that we might go to third-party vendors for, which isn't always very many because there's so much that's available within the Brown & Brown family, like which we talked about with the Medicare advocacy team. But yes, so consultants first.
Okay. Thank you all very much.
Thank you.
Thank you.
Okay, well, there's no guess on who's next. If USI would please come to the table.
I was trying to remove it down.
To make it more
there, but,
slide.
Yeah.
I'll work with mine.
That's easy enough. We can go to page 2 if necessary.
Can you hold on just a second? He's going to be right back. Again, I just wanted to thank everyone for being here on July 3rd. I think tomorrow is going to feel even better, being free.
I think we're on a TV timeout, is that correct? Are we waiting? They started the
I'm
clock.
sorry, say again?
I said, are we?
Oh, no, we're going to start over when
Yeah, I just want to make sure.
when our
Okay.
chair comes back.
I'm here with a jury of my peers in the back, so I want to make sure that we're handling this appropriately. Good. Excuse me. Good morning, everybody, and thank you. It is still morning. Thank you for having us. My name is Bill Crombie. I'm Senior Vice President and Practice Leader for USI Insurance Services here in Louisiana.
I'm Dustin Lale. I am also Employee Benefits Consultant here in Lafayette, Louisiana, and happy to be here in front of you this morning.
So again, we appreciate being part of the proposal process. We're here to provide some information and support of all of that material that we put together. And again, thank you for the information that you shared. I think there was a lot of good, some very good information in there. We don't have a lot of slides to go through, I guess, good, bad, or indifferent. I'm really just going to bring up some talking points, if that's okay. Basically, the focus that I would ask you to keep in mind, please, is for the team on the left. And I think you've heard from a number of people about the team, and it is important. I talk with a number of groups about, how they're structured and what they do, and, the old world age of brokerage or consulting with just one person is like having a one-room schoolhouse. That doesn't work anymore. You need science teachers. You need math teachers. That's why we're set up the way that we are. It is very important to have specialists who are deep in their discipline and working very specifically on behalf of each of our clients. I'm going to talk mainly in reference to question 12 from the Q&A, which was, other than reducing costs, what were the top goals? And that's really what the focus is going to be on. I'm not going to go into too many specifics on dollars, but I want to really talk you through some of the process. Again, as a consultant, I think it's important that we understand the information that we have available, what we're looking at, how we're going to use it, what are some of the indicators that we see, and we'll kind of go from there, if that makes sense. Okay. I would flow to, let's go to the second page, if you don't mind. Most of what we're going to talk about today really falls into these main service buckets, these main areas. As you can see across the top, HR services, we can talk about service. Again, we're a $3 billion organization, so we're pretty good at service. Actually, Louisiana was the top of all offices for USI nationally in terms of client retention last year. So, from a service perspective, I was very proud of that for our team. And we're going to talk about each of these areas and some items that we saw. Main concern was about deficits, right? That's a big piece that we saw. What are you going to do to help us with the deficits? When I have been brought into different clients before and taking over new groups who have run a deficit or have gone over budget for a year or two or had to go back to the well to get more money, there's usually two kind of global pieces that I would talk about that could make that happen. Number one is plan utilization, right? What happened? What are the things that drove cost to be what it was in the current year that maybe wasn't projected last year? The second piece is the actual budgeting process. Was the budget set appropriately? I have seen, unfortunately, math from other consultants about what a forecast looks like. That was completely incorrect, which actually causes sometimes a group to go over budget. And for a school district, you can't afford to do that. So, number one, we talk about underwriting and analytics. Setting a budget is not magic, right? But you have to do it appropriately, and that's very important. Again, you had a lot of good cost data that's in here, a lot of numbers and a lot of pieces of information about dollars. That's easy to use for the projection. The trickier part is about utilization, right? What's driving those dollars? And I'll agree with a point somebody made earlier. There is a lot more information that we'd really need to dive under the hood to figure out what's driving dollars this year, what's happened in the past, what are the trends, and what are we looking at going into next year? That would apply also to retirees, okay? What I saw in there is that the only retiree population that was broken out in the data were the Medicare Advantage folks. I think all of the other retirees within the Blue Cross plans are lumped in with active employees. And I think that that's not probably the appropriate way to look at that, especially when you're trying to draw trends in different populations, when one group covers things differently than another group. So I think we really have to bifurcate that and look at those two populations very differently. In total, you get back to utilization, right? There are things within the data that are very, very important to look at. Things like preventive care, like who's going to the doctor? And this all falls right now under some of the population management bucket. Are they going and getting an annual physical, right? That is extremely important. I very much appreciate biometric screenings. Being a 50-plus-year-old man, I've gone through a couple of them, and when I go out the door, I throw that thing in the trash, right? I'm the perfect weight for somebody 6'7". But that information, for the most part, never gets back to my doctor. There's no connection, right? There's no discussion. So, rather than, or to supplement that, that's a great start. One of the keys is we need to incent people to go get a connection with a PCP. get an annual physical, get on your blood, heart medication or diabetes medication. There's studies that would tell you that less than 30% of the population actually have somebody they would call doctor. Right? That's when people are going to urgent care, they're going to emergency rooms, or they're not going. So a lot of things can happen there. That's where the rubber meets the road. Right? We can talk about Blue Cross, United, direct contracting. That's just funding claims that are happening. We need to go upstream. This is upstream, downstream. Everybody knows that parable. We need to get upstream. Utilization, data, very, very important. Okay, now let's move on to some of the other things, right? We talking about network. I mentioned Blue Cross. Listen, our role as consultant is come in, see what you have today, and make it as good as we can without changing anything, right? We bring options. That's part of our role. What have we done successfully for other groups like you of your size in this area, current populations? That's all very, very important. There's some great things that we could model if you really want to save money, and you've heard some of them today. Direct contracting, reference-based pricing, narrow networks. There's a bunch of different things that you can do, but again, as a consultant, our first step is getting back together. What do you say? What have you already looked at? Culturally, would it even work for a subset of your population, right? We can put the math together, but if it's not something you can implement, then we have to look at other things. Within that, even steerage to better facilities, right? Whether it's from within the current arrangement with Blue Cross as your claim processor, are they effectively steering people to any low-cost, high-quality provider? That's right. It was no, it wasn't a real question, but yes, no, they're not, right? There are plenty of firms for a group of your size that could overlay your entire program, medical, pharmacy, and be a concierge-style advocate to steer people. When you have to get a pre-cert for an MRI or a CAT scan or something like that, or you're just asking for an ID card. Well, what do you need an ID card for? It sounds like, are you setting up an appointment, right? Or, hey, I see that you got your prior approval came through for this. By the way, there's 3 locations within a 5-mile radius of your house you can go. So there's companies like Quantum and Accolade, right, that can take the program you have in place and basically help individuals go to the best quality, low-cost providers that then helps the plan, and it also helps the member. Couple of other things, still in financial with our underwriting team, reinsurance, right? Reinsurance, very, very important. Large claims, I saw you have a $525,000 specific policy. One thing that really did make me very nervous is if, assuming I read it correctly, your specific stop loss is on a 12-12 basis. Okay, that means whatever's incurred and paid in 24 will be covered. Somebody goes to the doctor or the hospital in November, December, anytime during 24, and the claim doesn't get processed till January, February, it could be a $2 million claim. You have no cover for that right now. So as a consultant, not only are we looking at the immediate short term, right? I didn't mean to cause a kerfuffle there, but an immediate short term, what are we going to do now? As a consultant, it's also, what are the other things that maybe weren't even on the radar that we have to get in front of for future risk? You have things like stem cell gene therapies. They're $2-3 million a piece. You get one of those, right, that happens at the end of the year, comes through. I mean, that's one individual. So that's a big gap that I see. You've been self-funded for how many years? There's no reason to go with a gap like that. Pay the extra money, get full coverage. I started as an underwriter. I feel very strongly about that. The other piece is with stem cell and gene therapies, thinking about, there's a couple things you could do. You could get crazy and exclude coverage for those as a self-funded employer if you wanted to make those changes in your policy for the beginning of the year. Alternatively, if you continue to cover them, there's things like stem cell gene therapy riders for your stop-loss policy, which basically means yes, the claim above $525 is still going to be reimbursed as it normally would, but for, I don't know, $5 a head a month, something like that, $60 a year, you'll get your $525,000 reimbursed for that member. So it's a very low premium, but again, it's a way you can invest, 50, 60 grand, something like that if we do the math, to be covered for $500,000. Those are the types of exercises that are future looking that we would be helping you with. All right. Now I'm going to move over to pharmacy, falls under clinical. We have a couple of buckets there in clinical. One is care intervention. That's part of using the data and utilization to steer people. That's looking at things, what we call gaps in care. Are people getting their age-appropriate screenings? Are they, again, going to the doctor? We want people to go into the system at the lowest entry point for healthcare. That is a PCP. Very, very important. On the pharmacy side, yeah, again, I mean, definitely a full marketing review, consolidation of vendors, all of those things have been mentioned and truly very important. The other piece of that is the ability to audit, right? And making sure that whoever we're partnering with, as we do, have the ability to check those claims because, God forbid, the PBM is actually administering the contract in the way that it was drawn up, right? We want to hold their feet to the fire. That's part of the process of contracting on the front end, that we have that ability to make sure that there's no shortfalls and no gaps. Terms and conditions, pricing is great, rebates are great, but if you're only hearing about rebates, I would bet that the total cost at the end of the day is probably more, right? PBMs are not in the Fortune 50 for nothing. So that is a huge opportunity to save money down the road. And we have, just in the region, there's 4 pharmacy consultants, and we would have them certainly assigned here. So the other things in terms of savings, a couple things. Plan design is great, but that's a cost push to employees, right? I can raise the deductible for $1,500 to $2,500. It's going to save the school district money, but then you're going to get complaints on the other side that you didn't raise my pay, but now I'm more liable. That's not a long-term solution. Population health, I'm going to move into the wellness side, and this is part of what we talked about. Having to change care patterns and utilization. We use a very quick example of how many people here drive their car all year and never get an oil change? Well, nobody would raise their hand and admit it, that's right. But that's why people need to do the basics. Go back to the doctor, right? I want people on heart medication. I want people on, that is the thing that's going to help large claims down the road, is avoiding those types of situations that are unknown risks today. Let's identify them, let's manage them, and get in front of them. Once they're a large claim, they're a large claim. We can try to manage them and inpatient and all that stuff as much as you can, but they're going to be $500,000, $1 million already. The retiree, let me see, what else are we going to mention there? We already talked about the Oshner program. Again, we can build off of that. Again, I think it's a good start, but I think there's a lot more that can be done in that fashion. Retiree, Medicare Advantage, Medicare Sup, the active plan. Part of what I think is important is understanding, again, what have the discussions been in the past? How long has that plan been in place? What is it that retirees are looking for or not looking for, right? I don't know if you do focus groups. I don't know if you do, those are, you got to be careful, I know, sometimes about focus groups and things of that nature, not to commit to anything, surveys, but I think that's important to understand. What are people looking for? What are they comforted by? That also, in that feedback loop, gives you the opportunity to get in front of them and educate. If it's just an education session, you're not going to get as much participation. I think feedback is really important. And with that, I think I've spoken as quickly as I can, and I think I've hit on each of the buckets. So again, to highlight, lots of good data was shared, a lot of cost data, not a lot of what's driving it. Right. I talk about HR services and timing. We're here in July going into August. There's still plenty of time. I mean, a budget is just taking 24 months of information and looking at some utilization and projecting cost. Trying to impact that, right, going into open enrollment in September, we're going to have to figure out over that long-term plan, what can we bite off now? What's manageable, that's not disruptive, and what are the things that we can think about now into 25 to start implementing for 1/1/26 is the road that I think we're on. We're pleased to be here, and again, I appreciate having your attention, and I welcome any questions.
Thank you. Mr. Crombie, are you the individual that the superintendent and his staff will be working with on a monthly, weekly, or daily basis should you guys be awarded the contract?
Yes.
Okay, great. And where did you say you were located?
Our office is in Metairie. And I have 2 folks located here in the Lafayette area.
Okay. I'm sorry.
I do have 2 individuals, including Dustin, located in the Lafayette area. We have a couple of offices, Homa, Destrehan, and over on the West Bank, in addition to our office.
Thank you. In your specific practice, can you tell me how many of the self-funded accounts that you currently manage are with either Blue Cross, United Healthcare, United Medical Resources, Aetna, or Cigna? And on the second side of that, how many of your self-funded accounts that you currently manage provide healthcare benefits that you negotiated directly with healthcare providers?
So I am directly managing a handful of accounts, but I remain as the strategic advisor on another number of handful of larger self-funded accounts. I would say, I think right now we don't, we have Meritain, TPA, UMR, TPA. We do have one reference-based pricing that's not with one of the BUCA TPAs, maybe two. If that makes sense. And I do want to clarify the question again, as you mentioned, negotiating benefits with providers. When you say provider, am I negotiating with Blue Cross as TPA or actually going to the hospital for?
Hospital.
Okay, so in this market, we have one that we're doing that with now, and that's it. For the most part, the employers we have in the past and in other markets, yes, a little bit more. It's been a few years that I negotiated a very large RBRES style reimbursement contract for a municipality of about 15,000 employees.
If you were chosen to represent Lafayette Parish and you find yourself in a situation where any healthcare organization or insurance company provides you with any type of compensation whatsoever, whether it be commission, bonus, override, or any other type, will you immediately, in the most legal fashion, turn 100% of said compensation over to Lafayette Parish School System?
Yes.
Thank you.
And as an example, I would bet heavy money that in your current, one of your current PBM contracts, that there are per script fees going to somebody that we'll find out in the contract. And the way that unfortunately operates, because we've run into this before, that firm says, well, we're not going to take it out. They won't change the rates in the middle of the year, so that money sits there. So basically what we would say is, okay, Mr. Hidalgo, we're going to collect the $1.25 per script that's built into the contract. We'll validate that and then offset from now through end of December how much we've received and do a true up. But yes, transparency is utmost importance.
Thank you. Last question from me. As you may know, as you well know, we are one of few organizations where retirees remain on our health plan after retirement. Given that, do you have any real-life experience in creating ways to minimize risk from that specific population outside of Medicare Advantage migration?
So the short answer is no, personally, because we haven't had any clients still in that situation. However, I go back to my discussion on understanding the information for that specific population. When you talk about managing risk, may not just be moving them to a different fully insured platform. There may be other things that we can do to actually impact utilization.
Said it was my last question, but here's a follow-up. I'd like you to clarify, out of all the clients that you have, you do not have any clients where retirees remain on
that is correct.
Client's plan after retirement.
That is correct. Sorry.
Thank you. I know you already answered my questions, but I'm hearing that you have two employees who are working in Lafayette Parish?
In the general area, that's correct.
Okay. But others, how many in the state?
How many clients do we have?
No, how many employees?
Oh,
work with?
in the range of 40-ish.
Okay.
We're part of our Southwest region, which is headquartered out of Houston.
Okay. And if you mentioned a bunch of different things about plan management and changing care patterns and that sort of thing. If they were to utilize any sort of call center, who would they be calling into? I mean, you two are not going to be the ones answering the phone. You know, who would
That is
you-
correct. For the record, that is correct. I will not. So, no, so, years ago, like others, we traditionally would just take member calls at our office. But nationally, and being consistent, we found a way to streamline that. So we have 6 centers around the country. And again, it's very flexible. The center that would support Lafayette Parish would be in Houston for member issues. So if a member wanted to call in and had a claim question, I got an EOB, I got a bill from over here, what do I pay? They could call us. It's all HIPAA compliant. When they call in, by the way, they actually get the number of the person helping them. They get that same person through resolution of that issue so that they're not calling back in 2 days later or something to start the process again. Doesn't cost anything extra. If you don't want to turn it on, we still have it available behind the scenes because our team still uses them if we field questions directly. You all, of course, would come directly to us to resolve any of those issues that we need to.
Right. Okay, thank you. And then, how would you incentivize members to be educated on possible changes, changing that behavior of our employees and retirees?
That is the age-old question we all look to answer. I mean, there's no one answer, right? I think, again, how do you get people into an environment where they're willing to share and willing to listen and willing to learn? You know, sometimes it's a lunch, sometimes it's a koozie, sometimes it's a program, giveaways. Sometimes, again, it's feedback sessions. I think, again, I have found that if you're willing to embrace people and listen to them, they'll come. And then you can also, at that point, share, right? Best sharing is, I don't know your misconception until you kind of tell me what it is from your perspective. And then I can clarify from there rather than be talked to, I guess is the bad way to say it. Does that make sense? Good?
Yes,
Okay.
thank you so much.
You're welcome.
And have y'all or y'all currently or previously worked with any school systems
Yes, sir.
in Louisiana?
Yes, sir. I know at least one, if not two, that we submitted as references in our material.
Thank you very much.
Great. Thank you all very much. Appreciate being here.
Ms. LaBeouf, if you don't mind, could you come up to the table? Couple of things here I'd like to go over before we move forward. First thing is the folks of you who are not here to present have noticed, we do not have our regular meeting content on today's agenda because of the amount of presentations and the time it was going to take. However, I'll say that information now is probably more important for data collection purposes than any of our previous meetings. So I apologize that we do not have that on the agenda. However, it's possible. It's possible that we're going to have another meeting between now and the end of the month. But we'll discuss that here in a second. And if we do, we're going to put that on the meeting agenda because it's very important that we get that data from Mrs. LaBeouf and her team, especially because of the issue with the contract with Blue Cross and Osher and all that stuff. So it's a lot of important information that's not going to be presented today, but hopefully we'll be able to tackle that this month. If not, of course, it'll be next month, but we're going to try to make that happen. Secondly, to the presenters today, thank you all very much. I know, and I think my fellow committee members are aware that more than 6 packets were sent out for a return presentation, and 6 responded. And so that we know that there are some folks who looked at that packet and said, you know what, no thank you. But you didn't. You chose to take the time, in a very short period of time, you chose to take the time to put together your best value proposition. And for that, we want to thank you for the time you've taken to do that. And of course, to show up here today and give us your 15 minutes of fame. With that said, I would like to say that the superintendent, in my humble opinion, has rightfully asked that this committee not take any action on today's presentations. The superintendent has requested that he and his team get an opportunity in a very short term to reach out to each one of the 6 presenters and do a personal interview with their team. Maybe not the entire team, but a personal interview to get more in depth after having heard the presentations from everyone, to get more in depth on being able to ask questions that maybe were not thought of today. This is a very important matter. This is a $10+ million matter. No, this is a $77 million matter. And 10 million of it is problematic. And so it's very important, and we want to make sure that whatever we do, we enter into the right partnership. So I'd like to ask the superintendent to just elaborate a little bit on that request. I'm going to certainly advocate that this committee honor that request. And then once the superintendent is finished, whether or not we honor that request, I think it's important that we ask Ms. LaBeouf to give a very detailed brief, very detailed, to the point explanation, as blunt as possible, on what exactly we are looking for. We're looking for a consultant, not an agent, not a broker. What exactly are we looking for in the firm that we're going to choose? So, if Mr. Superintendent, if you
Thank you, Mr. Hidalgo. So first of all, thank again each and every one of you for showing up and putting forth, as Mr. Hidalgo said, your best foot forward. The most important thing that I was talking to each of these different members about is that we should not be rushing this decision. And coming to this particular time, of which we've heard 6 of you, I feel as though we're going to need to go back to our team, engage with Trish, also with Ms. Gardner, and everyone else that we're going to bring to the table to really make sure that we have additional questions to where we have that one-on-one. You're going to come into a conference room and we're going to have some specifics about what is it that we are looking for. But in conclusion, what Mr. Hidalgo has asked Trish to do is I want you to pay close attention to what we are needing here in Lafayette. I want you to put aside every business that you're dealing with. There are specific things that we are asking for here in Lafayette. And once those particular things are laid out for you, we're going to make sure it's in a contract, and we're going to hold each and every one of you, if you're the person, accountable for that. If anybody that knows me, we're going to be very straightforward, and we're going to make sure that what we're asking for, there is definitely some deliverables on your end. Trish?
I was going to say good morning, but I think it's afternoon now. So Mr. Hidalgo beat me to the punch. I would like to, first off, thank our proposers. They went above and beyond. I know it's been a long day already. So I appreciate your time, your efforts, your solutions that you've brought to the table for LPSS. So I appreciate it, and thank you very much. I've made some bullet points so I can make sure that I addressed the needs that we're having, the concerns that we have, so that you could hear where LPSS is and where we need to be. So I'm going to first start off with we need a trusted partner. I'm just going to pause there for a second. Okay? LPSS needs a trusted partner, a consultant that keeps our best interests in mind. I think that's of the utmost importance. I don't want to have a question with regard to trust. You need to understand our culture. You need to understand our needs first off from the get-go. Before you start hammering in what we need to do, you need to understand us as a whole to include our active and our retiree populations. So with that being said, I'll get to the nitty-gritty. Risk management is a huge piece. We need continual and constant monitoring of our risks driven by data. Data is what I'm going to emphasize too. I heard several presentations today that emphasized it, and I think it's going to be a key factor. We're going to need to pull it. We're going to need to assess it. We're going to need to review it and make sound decisions based on data. Data analytics, data analysis, this will allow us to quickly analyze and repivot too. We can provide strategic planning based on it. We can determine short and long-term goals based on it, eventually work towards a fund balance again. So data is at the top of my list. Your company needs to have it. You need to have the resources and the tools available to LPSS so that you can offer sound solutions to us so that executive staff and board members can make good decisions moving forward. Strategic planning, there was a lot of emphasis within the quote with regard to strategic planning. We're not strategically planning right now. Okay, again, the data is important because we need short and long-term goals in order to develop that fund balance goal again. Thorough evaluations of each contract assessments, that's going to be super important. The last presentation that we just heard said if I get into your contract, I bet there's a lot of information in there that you may not be aware of. I need a sound consultant who can review our current contracts Tell us if that's where we need to land or whether we need to repivot and go somewhere else. Negotiating power of the consultant. You've got to be a big player in a pond, large pond. I need a consultant who can bring their buying power to the table. They can negotiate with the vendors and deliver good cost containment for LPSS. So your negotiating power is important, and we need to hear about it. Member consumerism, I heard numerous presentations with regard to that. I agree with you. I believe we have wellness issues right now where we're not holistically thinking of the big picture. I feel like we have a lot of piecemealing involved in our plan currently, and we need a holistic approach to it. So I need you to communicate with our members that it's important that they understand that we are self-funded. It is LPSS that is paying for your claims and billing. It is not Blue Cross Blue Shield. Education is going to be uber important to where members know to go to an in-network physician to keep cost containment down. Same thing with generics and using prescription drugs. We need to educate our members for consumerism, therefore it helps our bottom line and theirs, because then premiums don't increase. Large claimants are of a huge concern to LPSS. We need monitoring, reconciliation, and follow-through of those reimbursements that will be coming back based on our stop-loss contract that you're going to review for us. I need compliance and adherence. I need a consultant that advises LPSS of those concerns, not only currently, but what's coming down the pike. I need you and your team to be educated, to give us the tools and resources available to us to make sound decisions moving forward. I did briefly mention on communications. Obviously, we have a team of currently 6. We are adding 1 more. It's a lot. It's a lot to manage. I need a communications extension from the standard department. I need you to be able to reach out in paper, which retirees have emphasized numerous times. I need electronic communications. I need support from that end so that our members are aware of what's going on with our plan. Obviously, enhanced, improved, and employee benefits packages. We want a positive experience for the member. Several presentations spoke on today, retention. We want our members to stay with us, active members. We want them to come to LPSS. We want to have that recruitment and retention. That's super important to us that we have a positive, wonderful benefits package. I spoke to a member the other day that's a new hire that came on board, and she told me the main reason I came to LPSS was because of the benefits. That's what I want to hear. I want them to want to come to our district and then stay for a long period of time. Obviously, minimal disruption to our members. We can't be making these big changes and then disrupt members as a result of it. It needs to be a positive experience, not only for the district, but for our retirees and our active members. So those are some of the main talking points. We have a lot of concerns that we truly just need an educated, I'm going to describe it like this. I want somebody who's going to be in the ring with us, taking the blows, and giving me sound advice on what I need to do in order to fight this fight. I don't need someone off on the sideline, yelling from the sideline, and not in the game. I want somebody in the game so that we can clearly address these issues and you bring it to our attention, whether it's good or bad, and the board and the superintendent make those decisions moving forward. We need to know everything so that they can make the best decision moving forward. That's it kind of in a nutshell. There's a lot more. Whoever that consultant is, I'll give you an earful moving forward. I'll close with this one last piece. Ultimate question. What is in the best interest to the district and our members to fix the operational and financial concerns to thoroughly support LPSS? So it's got to be in the best interest of the district and our members. So please keep that into consideration with anything else that you bring to the table.
Thank you, Ms. LaBeouf. Before we turn it over to the remaining committee members, I think you all can tell that we're pretty serious Not that we were not serious before, but I think we're more serious now than ever before. And I think Ms. LaBeouf did a wonderful job at outlining exactly what we're looking for. And I would advise you to keep the information that you bring forward on what, for lack of a better term, what we're going to call the second round, to those points, because I think that's going to be in your best interest for time, and of course in the system's best interest, and the superintendent and his team's interest. I think Ms. LaBeouf made it clear. You guys all know the differences in roles between a consultant, agent, broker. You guys all know that back in the day, the idea was to go in and look like a consultant, and then if I can get that business, then I can get all the other business. We're not looking for that. We don't want that. What we want is someone who's, listen, I understand that most of your organizations are very holistic. They have many different departments and components, and that's to be respected and commended. But I wouldn't want this to be viewed as, I want that to be a secondary in this conversation. Whoever's going to come in needs to be someone who is going to be directly working with our folks to solve our issues, not earn more business. And so I would hope that you would hold that mentality on the second go round. Members, are you guys okay with, we do not have to take action on this item today. Are you okay with allowing the superintendent his recommendation for his second go?
Yes, I think it's wise to pause here and not take action today. It's a whole lot of information that we've had to digest in 15-minute increments, and I think it's only fair for our public to be able to examine what the other, each company brings to the table, and also give us time, and Trish and her staff time, to really look through all of this carefully. I appreciate all the time and effort and cost y'all have made to get here today. What I would request our superintendent to do is to give ample time within reason to and pinpoint a date as quickly as possible, because there's so much planning for these teams to come in. And here we are on July 3rd, the day before a major holiday. This is traditionally a holiday week for the United States. And are we trying to do this before the 31st?
We're trying to, but if it doesn't get done before the 31st, it's more important to do it right than to do it fast. And, I think that we have plenty of time, but I'll let the superintendent speak to that schedule.
Okay, that's just my biggest concern,
Yeah, what I was thinking is that maybe we would let everyone know by July 18th, so that you can make preparations for that following week, which is prior to our 31st meeting, okay? That gives us, first of all of us can take time off as far as the holiday is concerned. It gives me and our team that next week to kind of decipher what we need to, but by July 18th, we will let you know, and it will be a one-on-one. We will be in a conference room, and we will just get down to, specifics about what Trish has just outlined for you. So by July 18th, you will get notice. And that following week is when we will schedule to get those individuals in here, okay?
Okay. My next question for the individuals that need to be at the interview, are you thinking that it would be the consultant, the person that Trish and you would be speaking with face-to-face, or do they need their whole teams?
Well, let me just say that again. I'm going to go back to what Mr. Hidalgo stated. We don't need a team of people to come into these meetings. We need the people that are going to be dealing with us every single day, making sure that they can deal with us and knowing what our concerns are and knowing how you would address those. So again, I'll leave it up to whoever is coming to the table. But again, yes, I understand you have teams of people that do things behind the scenes. That's fine. I have no problem with that. But there is going to be individuals that we will be calling upon, and we want to be able to pick up the phone and call someone and know that we can get answers, because we have members that may have specific issues or having issues that are happening over and over, and we got to get somebody on the phone. So think about that if you are ones that are a call back. Again, if you have to bring 2 people, you have to bring 3, but if Who are we going to deal with every single day that we can say, we got your cell number, we can call you?
Also, I had a question for Trish. In talking with, what kind of a consultant we need, what I've heard from you is that you need a true extension of your office. How many employees do we have?
I will have 7 when we're fully staffed.
Okay, so we
Ms.
have
Mason.
7 to manage 10,000 people.
Yes, ma'am.
So if there's anything you wanted to go further detail with, I heard you say it in many different things, but if you wanted to highlight what you need staff-wise.
So keep in mind, we've been short-staffed for a bit. I'm going to call it, waiting on water. But we are working towards that goal. We've got new staff members on board. We're super excited about that. And I need them to be an extension. My opinion is I need them to be an extension of LPSS to better support our members. It's going to be a positive for our members by doing so. They can do the things that we cannot do, and they can offer those additional services. I heard you mention call center a couple times, and obviously the communications was a big emphasis for you. Retirees have noted that they would prefer some paper prints and information like that. So I need them to step in where maybe some of our shortfalls may be and offer those services available through their monthly or their annual fixed costs. We don't want to add anything onto the quotes that they've already given to us. We want it to be provided within what they will give to LPSS from the onset. So yes, and I'm looking for a partnership specifically that will help support our team to better service our members.
Thank you. That's all.
Yeah, I'd like to just, I want to thank y'all for coming today. You're very informative, very educated us on a lot of topics that we have great concerns on. So I do appreciate you coming and taking your time and presenting to us. So it was, I enjoyed listening and being educated by y'all. So thank y'all very much. And I do agree with Mr. Hidalgo and Ms. Smith that, we should turn it over to the superintendent and his team for the next step.
Mr. Superintendent, do you have any closing remarks?
No, sir.
Okay. With that said, thank you all for being here today. This meeting is adjourned.